very, very close to 9:30. So let's make a start. So Borodar, good morning and welcome to everybody here in the room. Anybody joining us by the wonderful means of electronic communications. Just a couple of general points, if I may. We have two apologies this morning from our non-exec director team, from Jogger and from Martin. My usual words about governance for anybody joining us for the first time. This is a meeting of the Trust Board that receives reports, and we'll do that later in this morning, from all of our committees. The hard lifting work is done in terms of scrutiny and assurance in the committees, and the role of this board is not to repeat that work, but it is to satisfy ourselves that that work has been done and to receive any notifications of issues that have caused those committees particular levels of concern, if that is the case. Also, just to note that there are a couple of verbal reports today, which are normally written reports, but that's just a factor of timing. Those committees met very recently and it hasn't been sufficient time to create all of the appropriate paperwork. So we'll have verbal reports from a couple of our colleagues later in the meeting. Yes, Tricia.
Apologies, Chair. There's also Hannah Rowan who's given apologies as well.
Thank you. Yes, apologies. Okay, so that being said, we'll crack on with the meeting. Item number 2, declarations of interest. Anybody got any declarations? Thank you. Item number 3.
Typo is it's got me down as a non-executive director and Martin as the trade union rep.
Okay, thank you, Devon. I'm sure you'll correct those. Will be made. Everybody content with those minutes? Here we are. Good. Thank you very much. Item 4, the action logs. There are 2 items outstanding. The first one, Rachel, concerns the avoidable harm, which we put a note on there about us continuing to talk about that in board development sessions and so on, which we do all the time, I think. So if you're content, Rachel, we'll close that. That's work in progress on a constant basis. Yeah. The second item on there, was that you, Rachel, as well? I've forgotten.
No, Lee, I think.
Lee, right, okay. And that one's been closed. Oh yes, of course, that was the memo, wasn't it, about about cancellations of NEPS appointments, and we've received a memo which detailed in some considerable detail actually the breakdown of cancellations. So that's done and closed. Good. Okay, thank you very much. So that completes that. Everybody's happy? Yeah. The next item, item 5, is the chair's report. This has been a written report this time, and my thanks to the government team for helping to put that together. It's pretty comprehensive about my activities and various meetings attended. Very happy to take any questions anybody may have on that. Otherwise, take it as read. All content with that? Good. Thank you very much indeed. In that case, swiftly moving on to item 6, to Chief Executive report.
Great. Thanks, Chair. So as usual, I'll take the paper as read, but just draw out 4 or 5 highlights from this meeting's summary report. First of all, if I can go to the top of page 3 and start with congratulations to 3 colleagues, a trio of honours in the New Year's honours list this year. For 3 of our colleagues, Wendy Herbert, Jerry Adams, and Linda Williams. You can see there at the top the honours that they've received. I've written to each of them separately to congratulate them. Of course, they'll be moving forward in due course for their investiture. Moving forward, page 4, and the Manchester Arena inquiry recommendations at paragraph 13. There's a reasonably chunky update here on progress of the recommendations. 68 of those are relevant to us. Lee and the team are working through each of them in terms of our response to each of the recommendations which touch the organisation. In due course, we'll bring forward through board essentially a business case, because there will need to be investment to be able to satisfy the requirements of the recommendations. And we've signalled already to the commissioning team and EASC formally that business case will likely pass through here onto them for support in due course. So work underway on those recommendations, important recommendations, and we'll see more in detail in the next couple of months, I would have thought. If we can go forward to page 12, This touches here, the point I want to draw out on page 12 is the Hive survey. So the board will probably remember, particularly P&C colleagues, people and culture colleagues, the Hive surveys, which we've started. The first one of those is now concluded, and we've got the feedback hand here. 12% of the workforce took part and responded to that survey. And you might think, well, 12% is actually quite low, but bearing in mind this is the first one, and benchmarking, Angie, that we've had from others indicates that's actually a very good response for a first survey of this nature. Some really helpful feedback, I think, coming through in that kind of hot topics survey. Very quick and easy for colleagues across the organisation to respond to, a matter of seconds, not minutes and hours. And there's going to be more of these periodically, Andrew, as we go forward, taking the temperature on particular topics from the workforce, but also that feedback being important to us in terms of shaping our plans for the future. I don't know, Andrew, if there's anything you want to add there.
I've just had Jason, of course, and on top of that, we've also now introduced at the executive leadership team a 2-monthly focus on cultural feedback. And last week we had the first of those feedback sessions around the sort of qualitative data. So not just Hive survey results, but also feedback from moving on exit interviews, 3-month people joining us and how they're feeling, trade union feedback. So we're trying to capture as much information as possible so that we really do have that understanding and temperature. And we are going to share that separately with the non-exec colleagues and our trade union colleagues. It will come up at People and Culture, but we thought it was important that people could see that. So I think we are really trying to get that temperature, but recognising it can change. But really good to see this sort of level of engagement, particularly on that survey. People are willing and are being far more comfortable to tell us how they're feeling, but also when things are going well, but also when they're not.
Okay, thanks, Angie. And then just a bit further down, if I could draw the board's attention to paragraph 53 and 54. So this is the Anti-Racist Wales Action Plan and progress that we've got here, the requirements of that. And then paragraph 54, touching on sexual safety in the workplace. Again, good progress here. I was pleased, actually, Angie, to attend one of the Voices Network's sessions last week, which you pointed me towards, where an external speaker came in to talk about experiences in other places. A significant number of our teams on that event, which we hosted, but also colleagues from other services across the country. So again, really good work going on there in supporting our people with difficult experiences. And then the final point I just want to draw out is on page 16 and section. And I mean, I've done this before, but there is a significant amount of work going on with the estates team across a range of locations you can see here. Perhaps the two I just want to draw out are actually in North Wales with Ethli, the new station, which has been something on the books for many years, now got substantial progress underway, and also with the North Control Room, the North Wales Contact Centre project board being established for the relocation from Bryn Tyrion. So there's 2 paragraphs in the report touching on that, but a lot of good work going on locally, engaging with individual members of staff and supporting them with what will be a change as a project board established for that move, which will take place at some point, probably in the middle of this calendar year. So I'll stop there, but happy to take any questions on the report.
So, look around. Any questions? Yes, Paul.
Just a couple, if I can, Jason. Great to see the recruitment video seems to be really positive. The number of candidates has increased significantly, and the one thing on the Hive that we'll need to pick up through PCC, and I know you will at ELT, is this lack of confidence that concerns are being addressed. So we'll pick that up, and I'm sure through WASP that will be raised as well. But otherwise, really, really good.
Okay.
Thank you. Jason, really good report as usual, lots of content in here. I wanted to ask about point 40. In that section, you refer to a key focus for Q4 will be on the commissioning resource envelopes, and that 111 envelope being of particular concern. And I just wondered if you could say a little bit more about that, unless we're going to cover that off elsewhere in the agenda.
Rachel?
So this relates to the fact that the way we're commissioned at the moment in 111 is a spend and recover model. So perhaps the wording is slightly harsher than perhaps it is the word that we really feel, in the sense of, I think we want to move to a resource allocation model of commissioning. So we would, the 10.3 million that is available for 111 commissioning, comes to us with a series of outcomes which we then deliver on. At the moment, it's a spend and recover model. So if we don't spend 10.3, we wouldn't get 10.3. So it's that desire to move to that different way of commissioning that we're hopeful actually that we will be able to achieve through the new joint commissioning committee arrangements. There will be a transition period, we understand, between the arrangements now and the new ones coming into force later in the year. But it's the sense of wanting to move from a spend and recover to a resource allocation that the teams are kind of working on and trying to enable.
Okay, thank you.
I had a question. I'm not sure whether I read it in this paper or somewhere else, but I think I read a reference to 2P arrangements for the 111 staff. Did I misread that? Was that a factor?
No, we've got
No.
we've got
No.
tubing. The
We
tubing
have
is obviously
done.
for transfer.
Cost, but not.
We haven't got
So when
any-
this commissioning arrangement changes, that doesn't affect their employment in terms of they don't become employed by Welsh Ambulance Service.
They already are.
They already are employed
Yeah,
by
so
us.
we
so
haven't
no
got-
difference. That's fine.
we haven't got any active tubing arrangements.
No, that's fine.
Let me just confirm, because we haven't got any active tubing arrangements underway.
No. That's good. Okay, that's my confusion. And the other point I would just make as a matter of interest on facilities. I went and visited the new maintenance facility in Merthyr yesterday, which is referenced in your report, Jason. And it's fantastic when you go and see these places. These are the unsung heroes, and it's just worth, I think, recording the fact that I was so impressed by the quality of the service there. You could eat your lunch off the floor. It was absolutely amazing. Beautiful building, lovely facilities, and the enthusiasm of everybody, down to the engineers, actually working under the ambulances and the ramps, and the people in the back office and the stores and the professionalism of the way it's done. And I know, from my old background of aviation, these things were always very carefully monitored. And it's like going back in time for me. It's like going back to sort of aviation stores where everything was racked and labelled and it was all systemized. It was just brilliant, really impressive. That's really good. Okay, any final questions to yes.
Thank you, Chair. Not a question, thank you. Just a comment I'd like to make about paragraphs 5 and 6 with regards to the Welsh language. Just wanted to acknowledge really that it's great to see that the internal translation service is now up and running, because that's something we've been working towards for a long time as part of our development of the Welsh language. And equally, paragraph 6, really pleased to see there's training available now to build the confidence of some of our staff in 111, because they've lost confidence over the years of not using the language. That's brilliant to see, actually. So well done to everyone in getting us to that point. Thank you.
Okay, last moment, just looking around, make sure I can know all the hands up. Okay, thanks very much, Jason. So let's move on to item 7, questions from the public. And Estelle, we have a question.
We do, Chair, and Boridar Pawb and Boridar, good morning to everybody who's on screen. We have one question this morning from Rizwana Nadeem. And Rizwana, I don't know if you're watching, I hope you are. And it's a question on evening dialysis transport. So if you'll indulge me, Chair, I'll read the question because it gives a bit of context, and then I'll hand over to Lee, who I think is prepped with a response. So Rizwana's email reads as follows. My question is evening dialysis transport. I have been told by dialysis nurses that they have the capacity and staff to carry out evening sessions for kidney dialysis, but transport refused to provide travel to the renal units in the evening. I have seen many renal patients who are getting older and cannot go to the University Hospital of Wales due to daytime only renal dialysis. Sorry, I misread that. Renal patients who are getting younger and cannot go to university in Wales because of renal dialysis. I myself have sacrificed my career and ended up working fewer hours and suffering great financial loss due to daytime renal dialysis. The rest of the UK offers evening sessions. That is why I could not take my previous employer to a tribunal to save my job. Kidney Care have carried out research and have seen the poverty in renal patients in Wales due to this daytime only transport. So I think the nub of the question is, why are we not able to provide evening transport to evening renal dialysis sessions? So Lee, if I can hand over to you, please.
Thanks, Estelle, and thanks for the question. It's actually it's a really enlightening question, isn't it? And a lens into some experience for some of these service users. The nub for this for us, however, is that we are, of course, the commissioned provider when it comes to delivering the non-emergency patient transport service. And for renal, that includes the Welsh Kidney Network, as well as the health boards themselves. We do continually work very closely with our commissioning team, the network and health boards, to review the services that we are providing for renal service users. We are on occasion advised that the manner in which dialysis services are to be delivered could change. So that could be either a change to location or a change in the operating hours for those units. And where those changes are supported by our commissioners, we would adjust services to meet those operating needs. We do currently deliver some twilight dialysis services in Swansea and across BCU. And if that was to be considered and supported by our commissioners elsewhere in Wales, we would, of course, respond to those requests. So the nub of the answer really is that the transport provision is a response to the operating provisions of dialysis units, and the operating provisions of dialysis units is really owned by the health boards.
Great, thank you, Lee. And I can confirm, Chair, that was the only question we had on this occasion, so I'll hand back to you.
Okay, thanks very much. And just following up on that, that means, I think, Lee, that if the health board changed the availability of dialysis, we could match that with transport.
If it's yes, if it's commissioned in that way,
yes.
So that would be a
yes
adjustment to expectations and potentially the money flow.
Thank you. Any other topics on that? All happy with that? Good, thank you very much. In that case, we're going to move on, and we're going to move on to the staff stories. So, Alex, if you want to go and get Pete Brown, we're going to be talking about the 111 service. And whilst we're waiting, it might be worth saying that I spent some time last week going up to visit the potentially new 999 service up in North Wales, and at the same time went to the 111 call centre in Aylway, which is very, very impressive, very much like the one upstairs in BPH. Really, really, really good facility. Excellent. Pete, good morning. Welcome to you. Nice to see you again.
And you?
Our paths keep crossing virtually and really, which is lovely. So I think the floor is yours.
Okay. So, good morning, everyone, and thanks very much for having me. For those I haven't met before, my name's Pete Brown. I'm the head of service for 111. I'm invited to provide a little bit of reflection on a bit about my story, but also a bit about some of the work and approach we've taken in the 111 space with some of our people of late, with a particular focus on engagement and some of our thoughts and direction of travel. So just want to start with a bit of my story and where I've come from and how I've ended up here. After I left school, I started my career working in a chocolate shop. Not just any chocolate shop, arguably the best chocolate shop that there's ever been. And for those who remember it, and that brilliant servery where you could select your own chocolates, that was the pinnacle for me of like British high street. But as set the trend for what was to come, we weren't just any Thornton store either. We were the highest performing Thornton store for the Southeast region. I was born and raised in Berkshire. But having left there, I then moved into my first ever leadership position and took responsibility for another store just down the M4 corridor in Slough. Now, Slough is quite a different town to perhaps the one I I started in with a very different staff group, going from being incredibly high performing, selling lots, and indeed we had the record for the most amount of ice cream sold in a single calendar day. Moving to Slough, which was little more than probably, well, for those of you who've seen it, Victoria Wood's Dinner Ladies, that was a good description of where we landed and the kind of staff that I took responsibility for, and engagement with a very different approach that was needed to achieving performance and getting good results. Ultimately, I left there and decided to join the ambulance service. And as you can see, I joined it with an incredibly dodgy haircut and some orange highlights, as we, all do, a reflection of the amount of mistakes that we make through our lives and the choices that we take. So, working clinically with patients for the first part of my career, and just the most amazing career, working operationally. And now it gives you the opportunity to be there at the start of people's lives when they give birth and be there at the end. And there are fewer greater privileges than that we have. And for all the difficulties, that's always for me an incredible reminder about why we turn up to do this job every single day. But as it was, and for those of you who worked operationally, you might identify with it, but the limit of my clinical expertise ended with the ICD Green Book, which was little more than effective blanketing and a bit of wit and charm. As university education came in, that really wasn't enough to come by. So I decided to continue my career in a variety of different roles, and having worked now across 4 different ambulance services in different roles, from operational management, EPRR, and transformation, organizational resilience, and a range of others. Just the most widespread but really, really fantastic opportunities. I've been able to dangle off of helicopters, meet Barack Obama, be the tactical commander for the Olympics in Weymouth, and strategic commander for the release of Novichok in Salisbury. The range of experiences that we have from this wonderful world of the ambulance service is just unlike any other. But really, there are a couple of things from those early days and before I arrived in WAS that kind of signaled a bit about what I'm going to come on to. And the first is my desire to generally try and look at things in a slightly different way to see if we can achieve something slightly different from it. And I put that picture there of that lorry as one of my pride and joys of projects that I put in place in Bristol as a challenge to think about how we deliver services differently and redesign the world of the ambulance service into the first ever articulated lorry HGV. Now, we didn't have green credentials back then, otherwise I'm not quite sure it would have stood the test of time, but gives you an insight into the kind of solutions that maybe I was thinking about in a slightly different way to how we've always delivered a traditional ambulance service, and speaks to so much of the work that we're trying to do now with reimagining what does an ambulance service look like and what should it do. At the same time, and just before I came to WAST, I spent 2 years with the NHS Leadership Academy. The most amazing for me transformational experience is absolutely right, as I like to reflect perhaps now on what I do well, also back then on what I didn't, and some of the behaviours that really were very much built into the ambulance culture were a lot of those that experience for me challenged and rectified, and the opportunity to work with colleagues from so many different sectors was a really valuable and incredible one. So that's a bit about me in terms of where my career's been and how it's got me to where I am today. So just want to talk a bit about my approach to a lot of what it is we're trying to do, not just in engagement, but also performance and quality. In fact, every facet of what we're doing. And the one thing that really excited me about this role and coming into 111 was the idea that we could do so much really differently, really quickly, and challenge a lot of the rule books that hamstring us all the time, and the desire to rewrite those rule books and create change very quickly. But of course, we know you do that, you fail a lot, you get a load of stuff wrong. Now, the great successes are the ones that people often talk about. We'll come on to some of those that perhaps been more successful. But for me, we have to be honest that behind every failure, there's probably 100 bad ideas that I've dreamt up that haven't worked, haven't flied, have gone by the wayside. Hopefully, we identify them early. We talk about trying to fail often, fail quickly, but fail safely. The NHS kind of is a very cautious being, and it wants to perhaps move quite slowly at times. Whereas we try to change that to move very quickly, but fail often, learn really quickly, and have the humility to know that we're not going to get all this stuff right. That's especially the case with engagement. I'll just come on to a couple of, I guess, a challenge that we were looking at before winter, really. Now, I'm a stats man. I love a graph. So when I look at the measures of engagement, well, my PADRs are above 90%. That's pretty good. Right? I should look at that and be really, really content with that. My rate of one-to-one compliance, and we in 111 offer all of our staff a one-to-one once a month. Again, over 95% of our people are getting that every month. On the face of it, when you just look at the numbers, we should have engagement licked, right? We should be really happy with where we are. But equally, we were looking at, in some of our teams, really high rates of absence. That doesn't speak to really great engagement or really great workplace experience. And a lot of the performance gains that we've seen be made and changes had perhaps started to plateau with a look ahead to what was becoming a difficult winter, trying to seek some different approaches, recognizing that we don't all have the monopoly on the best ideas. So many of the best ideas really are out there in the people doing the job. So that led us to do some thinking on a couple of examples of two different initiatives, but came under the one banner. Thanks. Now, I don't know if any of you have read his books, but we were doing some reflection. I came back to an idea that Paul McGee talks about in a lot of his books, the idea of a beach ball. And this kind of underpinned the initiative that became 111 conversations in 111. We're all looking at the same beach ball, but we're seeing different stuff. As managers, we're often seeing green and red. What our staff see is blue and yellow on occasions. And it's the blue and yellow that we really want to get to understand what is the perspective, what's landing, and what's not. And also try and keep ourselves honest and honest enough to not fall for some of the not just focusing on the good stuff. It's very easy to hear the praise and hear the reflections of positivity, and then begin just to focus on that and believe all of your good PR. Best thing to do is hear your own bad PR. So that's what we did through an initiative that became known as 111 Conversations in 111. And it took two forms. One was with a specific team that we wanted to test, and then the rest was across the rest of the 111 operations. The first with one team. That team had 47% sickness, extremely high attrition. On the face of it, incredibly well-resourced in terms of leadership capacity, but clearly those individuals were having a really rubbish experience in work and coming to work. Those numbers really speak for themselves. having tried a range of different approaches, the first manifestation of the 111 conversations was sat in a room like this with all the team, trying to understand the other side of the beach ball. Some really honest conversations, not just the traditional ones you might have as part of sickness absence management, but really trying to get to the heart of the why, with really direct conversation in the room with those staff, with our trade union colleagues, about what is it about your experience that means this is happening. A fascinating day full of the most candid conversations, with some really great feedback, some really difficult feedback to hear as well. And sometimes the humility to hear the difficult feedback is where some of the rich stuff happens. But we left that room with a plan, a shared plan, and a charter that every single member of staff and every single manager signed up to in terms of actions, behaviours, and stuff we try and do going forwards. That team now, for the 7th week in a row, is recording 0% sickness absence. We've seen a sizable increase in performance, and attrition has dropped to record levels for that team, well below the average for 111. So on the face of it, a really valuable initiative, but very bespoke to that team. So then we thought about, well, how do we take this further and begin to broaden this conversation? And that's really where the broader 111 conversations came from. So we just wanted to move into a position where we were having more real conversations, not just first-line managers with their people, but every manager. So we invited everyone with a leadership responsibility in 111 operations, and then middle and senior managers from across the organisation to come into 111 and complete a conversation with a member of staff. Ideally, somebody that they don't manage, an environment that's slightly different to their normal, and have a really good, candid conversation about what's it like to come and work for us, and what are they seeing on the other side of the beach ball? What can they tell us? And it was fascinating. In the end, in a 2-week period, we completed over 160 conversations, each lasting broadly an hour. We had colleagues at every level, from first line managers at kind of band 5 through to exec colleagues come and join us to come and do it. And that got a fascinating range of perspectives on that beach ball. Now, that led to an immense amount of feedback, as you would expect. And our tracker currently shows just over 500 individual pieces of feedback that we think is actionable. But what was amazing in those conversations was we didn't hear what I expected to hear, which is something that would require millions of pounds of investment, significant transformation. The other side of that beach ball was something far more basic, far more fundamental, that we've probably taken our eye off as we sought to resolve the big stuff, the big transformation agendas, the expensive stuff. Now, what people wanted was, and I've summarized it there in a few key points. They wanted to come to work and feel safe. Some of our people didn't. And it was amazing in those conversations how the conversation got into very candid places about how that affected their sickness record, for example. It never occurred to me that someone in a 111 call centre wouldn't feel safe. They also want to feel comfortable and have a good environment to work in. We heard some incredibly positive things. People who worked in TLW and VPH, we know were very modern sites, gave us incredibly positive feedback. It wasn't all bad. Yet there were other places where that simply wasn't the case. We heard a lot from our colleagues about them wanting to work in a way that suited them, rather than the kind of one-size-fits-all approach that we're trying to get from them. And the amount of flexibility that they're challenging us to give them is very different to what's normal in an ambulance service environment. But it's absolutely right. Because again, a lot of those conversations suddenly got to what's the impact of that? Well, then you start to make the link to sickness, absence, attrition, and it all makes sense. But it also allowed us to make some really quick interventions. We heard day one of these conversations from 3 individuals who loved the job, told us they loved the job, but were thinking of leaving because on their 12-week roster, there was one shift they hated and they were thinking about leaving. By the end of the day, we contacted every single member of staff involved in that roster and changed it. Now, you can't do that on every occasion, but there you see the connection between having a really positive and engaged conversation and 3 people now coming to work with better sickness records and then not leaving us. They told us that they wanted a voice and wanted to be heard, and many reflected this was the first time that they felt heard. But I also heard from them the challenge about making that feedback matter, making that feedback count, because otherwise they're giving us honesty. But if we don't make it matter, they'll never give it to us again. So that's something we've had to work really hard on, how we make their voice heard and how we tell them that it matters to us. We also heard that people want to know that they're doing an amazing job, because most people come to work to do an amazing job. This isn't the kind of place you come to if that's not what you want to do. And we had many conversations about what that looks like. It challenged some of our preconceptions around performance management, perhaps, and how unwelcome that might be at an individual level. Now, the vast majority of people were seeking more of it because they wanted the recognition and knowing they were doing a great job. But they also wanted more for when they weren't doing a great job. So we could create more of an environment and further the work that we've already started on allowing people to be more honest about when they are struggling with something so we can make an intervention. And they're the main themes that came through. Some of those conversations were tough. Saying yes is the easiest thing in the world. And I've given some examples there of where we said yes. For everything we said yes to, there were an equal number of conversations that were based on, we just can't do that and here's why. But there's something about the authenticity of that conversation that was incredible, because it developed genuine understanding for everybody about both sides of that beach ball. So an awful lot of insight that we've begun to turn into some actionable initiatives. We heard, for example, from call handlers who wanted more flexibility to work. So, for example, then we've now implemented a trial for them to work from home. There's a variety of things that we've done as a result, but there's still plenty more to go at. There's always a risk with these things that you give a name that is seen as a one-off. But the real legacy of this in some of the learning for our management team was the importance of recreating these honest conversations. That creates the right environment that allows them to be had. So we don't just do the things that we think make great engagement, like PADRs and one-to-ones, but actually something a bit more unstructured sometimes that gives us a continual focus. We've also spoken to other colleagues in other parts of the business who've wanted to understand this. And the thing I've told them is this won't necessarily work for everybody, but the principles there of how we game both sides of the beach ball can be applied. Might be differently, but could be applied elsewhere. It also made us keep ourselves honest. And I've put it at the bottom there because it's something that we as a team try to hold true to, which is to continually see ourselves critically, but not cruelly. We made tremendous progress, but we wouldn't be being honest if we didn't identify there's still so much more to do. And we will still find that if we do that by trying to do that by having a more open and authentic connection with our people. So apologies, I'm not sure I know I'm doing for time. Happy to take any questions.
Thank you. I mean, that was brilliant. Thank you very much. Congratulations. People know my thing about PowerPoint. I'd like to congratulate you personally on using PowerPoint so fantastically to illustrate the point, but not to repeat the point. Thank you. So, questions for Pete? Yes.
It's not a question, it's just to say thank you, Pete. We were really keen to shine the light on a leader in the organisation, because sometimes perhaps we neglect them in terms of that focus. So thank you so much for sharing it and shining a light on some of the great work that's happening, but also recognising it's not easy. You know, part of our people and culture work is all about learning, listening, developing, and I thought it was a really excellent example, and it's so good to hear your own personal story, but also then to see how you're applying that with your team. And the role modeling we're expecting of our leaders is key to this, and so really lovely to hear as well that people are reaching out to you to find out what you've been doing, but also that you're giving them the honesty of sometimes you can't just lift and shift, it has to be adapted. So excellent, thank you so much, really appreciate it.
Yeah, several hands going up. So I think we've got Johnny and then Paul and then Bethan, and then we'll see where we go from there. So, Johnny.
Thank you. Yeah, just thank you again. Just demonstrating that's really important. I think it was a reminder of why we do what we do. We're an organisation that was created by people. We improve with people, but we do it all for people. So for me, that really resonated quite strongly today. And I guess the bit about legacy, again, I was just reflecting on that piece. The internet's 31 years old this year, and that was created a long time ago by someone who thought, probably help these scientists move data from here to here. So I think what you're talking about, that creation of culture to be able to be so open and transparent, but again, keeping people at the center of it is really, really important, and something that I'll be taking back as well. I think it's a good reminder of that today.
That just epitomizes for me what we are trying to do and what the board should be doing in terms of the people priorities that we've got. It's very brave to do what you've done. I think to ask people for their honest opinion is really difficult. So congratulations. And I love the beach ball. I think that's so simple because everyone recognizes a beach ball from when you're a child. So I thought using that was really good. It's probably better than the colors we're using that we've been through, because it's the same colors. So using it as a beach ball I thought was really good. The one thing that I wasn't sure of, so for that team that you did a sort of pilot and then spread it, did you have the similar results across the organisation?
So for that bespoke approach with that individual team,
Yeah.
We haven't scaled that further because that was very much a nuanced approach to that one individual team. The nature of the way that 111's currently set up is not many of our people work in teams, so it's not particularly scalable in the 111 environment. It might be there are other environments where it can, but we are absolutely seeing the results from that particular team from just a really raw conversation both ways.
It again, it impresses me that we could potentially look at how that happens in different stations, different groups of staff, etc. So it is transferable in that way, but you may need to nuance it. Great piece of work, I think.
Thank you, Chair. Pete, thank you for that. None of us could fail to hear your passion, your enthusiasm and your energy with everything you discussed. And I've no doubt that those personal attributes are what helped you get to the point you did with your team. Paul has sort of picked up on the key question I was going to ask, because my question was going to be around what can others in West learn from what you've done with our one team, because the results and the impact that's had is phenomenal. So to go from 47% sickness, 7 weeks later, 0% sickness, the attrition rates have gone down. That is a huge turnaround, isn't it? And I've no doubt that there are lessons that can be learned more widely across West. And that would be my request, really. And I guess some thoughts from you about how can you help shape some of that change and that progress elsewhere? But hats off to you, because you know, as Angie said as well, the leadership themes that come across from you are really to be commended. So thank you so much.
Thanks, Beth. There's a rush of hands have been going up. So we've got Kevin and then Lee and then Liam and then Rachel, if that's okay. So
Pete, I'm Kevin. Yeah, thanks for the haircut reminder. If you'd seen me in the late 70s, you wouldn't really recognise me, I don't think. I just leave it then.
You want to see photos?
Yes.
Let me just say, Dingwalls, London, and a band that was singing about anarchy in the UK. Pete, it's as you were talking, it struck me. We've had a report, or we've seen a report from HIW around, issues across the NHS in Wales and probably wider, but certainly in Wales. And as you were talking, I keep coming back to this phrase in that report, which was about learned helplessness. And as you were talking, I was thinking there's got to be a way to generalize what you are talking about in order to tackle that across wider than just WAST. I think there's huge potential there. I just don't know how we generalize it into the conversations wider. But are you publishing a report? Are you going to write anything up on this? Are you? Have I given you a piece of work to do?
Certainly had the intent of. We haven't as yet.
Because I think it'd be really useful.
I think it's part of not just this, but more broadly about some of the stuff we've done in 111 is about trying to change what I found online, which is an externalization of what's going on to people. It's all about, so much of it stems probably from the pandemic, where there was a load of stuff that happened to everybody. There was a negative experience, but failure and our inability to achieve together is the result of all of those external factors we can't control, to more of a focus on challenging ourselves to control more of what we can and trying to identify those things. And those things we can't, be honest that we can't, park them and try and move on. That does mean, and probably comes back to the bit that I think is my biggest point of learning, which is trying to be braver with the honesty in the conversation. There is a natural leadership kind of tendency to want to tell your team that it's going to be all right and you've got the answer and you're going to be able to fix all this stuff for them and you're going to be able to make everything amazing. And we can sometimes do that when actually deep down inside we know we can't solve some of those intractable system or societal issues that are affecting them, whether that's about the cost of living, whether that's about COVID, whether that's about health policy. Can't solve any of that. But you can get so much more traction from the honesty in that conversation than moving on to, so what is the stuff we can fix? So if you take the 47% sickness, that's all in our gift to fix. So really honest conversations about what we can't, and then move that honesty into, so how do we do that? Because from the team is for them to come to work, be happy, get great performance, all of those things. What they want is the enablers of those things. But you do have to create enough trust that allows that to happen, and that won't be immediate everywhere. And that requires some work.
Thanks. Yeah.
Thanks, Kevin. So Lee, then Liam, and then Rachel. So Lee.
Thank you, Chair. Let me start just by saying, Pete, I'm sitting here with a real sense of pride in what you've done, being from my team. So well done. And what I think this shows, number one, the changing guard in 111, because Pete is absolutely leading a shift of management and leadership in 111. And I think the reason that we are seeing the improvements from 111 that we've seen is down to Pete and his team and the work they're doing. So I just wanted to acknowledge you, Pete, for that and the team. For me, what this also does is it starts to break down, I think, some conceptions that in operations we care about data, numbers, and not the people. And actually, Pete's attitude to our people is becoming much more, and is, I would say, far more prevalent than you would perhaps credit operational managers for. And I do see this time and time and time again, how our operational teams and management teams have a real focus on our people. But to do what Pete has talked about takes real skill. Because as Pete has alluded to, it's not always about sitting down and saying yes, 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 because that's quite easy to do. And our managers, of course, don't always have the ability to say yes, yes, yes. Now, it's been helpful because I think we've been doing work that has been training and equipping managers to have the skills to engage in conversations where perhaps they're not going to be able to just say yes. So I think I just wanted to acknowledge as well how important it is our management investment is to continue to enable them to do what Pete and his team have done. There is absolutely an advantage, I think, in Pete's part of the business compared to others. There is a luxury, and I'm going to use the word luxury, in having all your people in one place, with all your managers in one place, because the access for those conversations to happen is far easier to orchestrate, arrange. And therefore, when we talk about our staff in the field, where managers are distant and remote, much more, there's more autonomy, there's more planning, and of course, there are patients that need us. So I'm not saying that should be an excuse, but it certainly adds a complexity when we start to say, okay, but what about everywhere else in particularly for operations? So it's something that we just would need to bear in mind. But equally, this suggests perhaps why we should be investing in doing that. My last point is, because I always finish with something that's cautionary, for me, we need to just keep in mind the coordination of this against the NHS staff survey, the Hive surveys, PADRs, informal touch points, because this stuff is happening. My anxiety is about, well, let's now do this, because this is something else that's already on top of WAS Live, CEO roadshows. Now, if there's one thing I do think that the organisation has plenty of, it's engagement opportunity. So my cautionary is for, there's a bit inside of me that's like, everyone says, well, this is fantastic, do it everywhere. It's like, yes, but we do also have X, Y, Z that's ongoing in the organisation to which we need to coordinate and respond to. So really fantastic, a great presentation, proud as punch, great to see the improvements. But everything's really tying in nicely together, I think, in terms of the broader cultural, people and culture agenda. So, thank you.
Good, thanks very much, Lucy.
Thank you, Chair. Just a couple of points, really. One is just to highlight what we've talked about here significantly is the benefit that comes for our people and how getting it right for our people impacts and deals with retention, deals with kind of feedback, etc. But as Lee's just alluded to, critically, what we can also see through the board papers is the improvement of care that patients are receiving as a result. So there is a direct correlation between getting this stuff right and the quality of care that patients experience. And I think, Pete, you've done some incredible work on all of those fronts over the last little while. And the second bit is actually just to note that Pete has been leading and doing all of this while also working incredibly closely with a number of us on the digital modernisation programme for 111, which has not been a light task over the last 12 months and has required some significant diligence and planning and contingency thoughts. So in amongst all of that brilliance, there is also another element of brilliance and commitment and dedication that Pete and his team have shown, which I think kind of just makes it even more inspiring.
Thanks, Liam. Bit the echo of that. I think Estelle next. Rachel next, and then Estelle. That's it.
Yeah, thanks, Pete. It is absolutely brilliant, and I was really just going to say that, I mean, Angie and I have been talking about how we can build on this for next year's IMTP, that kind of sense of, how do you create that conversation with people when it's very difficult out in the field, but how, and there might be different ways, but we absolutely, when we come to the next board development and see some of the priorities coming through, I think we need this to be featuring large in terms of our the priorities we place in the people and culture space. So really leading the way, and hopefully we can learn lots to see how we can use some of those ideas elsewhere. Thank you.
Thanks, Rachel. So,
Thanks, Chair. A great presentation, Pete. Everybody said it, so I'll add to the plaudits. I just wanted to make an observation, which is, and I don't know how you feel about this, Pete, but one of the things I think is really important that we support our managers with the things they have least of, which is time, because that must have been an incredibly time-consuming but valuable piece of work for you and for your leadership team. And we ask a huge amount from our leaders and managers, not just what Lee's talked about in terms of, PADRs, the whole shooting match, but the thing that delivers the most, I think, and I think that comes through from Pete's presentation, both for his team and for the service, and by extension, the patients and the organisation, and indeed cost avoidance, dare I bring money into it, because the whole thing about losing staff that are well trained because we can't meet their needs, and then having to go out re-recruit and continuing that cycle, the effort that goes into that. If we can somehow look to support our leaders and managers across the organisation with things that add the most value. And I think that is an example of something where, from your own initiative, you've taken the time to do that, and that has added the value. And, Lee alluded to all the other, plates we've got spinning. It's not just the people and culture stuff, is it? It's everything else. It's the performance reporting, it's the troubleshooting, it's just keeping the wheels turning on the bus. So I think for us as a board, and particularly as an executive leadership team, there's something to reflect on about what do we ask our people to do, and what is the bang for the buck that we get for it, because that's an example of that investment of time probably making the most difference in 111 that we've seen for many a long year.
Thanks, Estelle. And probably last word from Damon.
Yeah, thanks, Chair. Yeah, it's just a comment, as you said earlier on, about the feedback as individuals, and the feedback from the management team is absolutely right. But I need to say, from a TU perspective, I haven't been over the top of exactly what's been going on, but it is absolutely right and proper to say that the feedback that's come from the TU team has been really, really positive. So whatever you did in there, it was definitely working because it was coming through, and they all are lined up to work with you again. So if that can be cascaded, yeah, brilliant. Thank you.
Okay, well, look, I think looking around, probably a really good area. Thank you very much for your time. Couple of comments for me, if I may. I had the pleasure, Pete, as you know, just kind of eavesdropping really, sitting in a your management meeting the other day when I was visiting up in North Wales, and thank you for allowing me to sit in on that. You gave, I thought, the most fantastic brief presentation on the December experience, and I just think it might just worth reflecting and letting you say a few words about your December sickness, because you talked about one particular unit, but I think you were commenting at that meeting about how December sickness will sort of beat all the normal trends.
Yes, we were reflecting on December performance and some of the enablers of that. And I think, at kind of a headline level, this December versus last December, we answered 26% more calls, which is the bit we can control. There'll always probably be more demand, but the bit we can control is what we do. So answering 26% more calls, triaging 13% more patients. And we took a very different approach this year to we called them time off arrangements, not annual leave arrangements. It's about how we give people space. Didn't get all of that right, and we're doing some reflection on that now. But normally, I'd bet something the size of my mortgage on sickness going up at Christmas, because it does in every environment, in healthcare, everywhere. It's one of those things that's bedded in. But we saw sickness go down, and that's something that I think is a really interesting indicator of working differently with staff about how we could make December work better, work differently, working with trade unions. Say not perfect, and we're doing a listening exercise now, but some of the things we did had a really positive impact as a result then for patients.
A couple of other comments just to make as well, just to share my thoughts, if I may. Kerry and I spent a little bit of time in the 111 centre very recently upstairs in Vantage Point, and I've met Paul up there, isn't it? I've met Paul on a number of occasions, and I have to say his enthusiasm, Kerry, is infectious, isn't it?
Absolutely.
It's just brilliant, and that's not a one-off. I've met Paul now on a number of occasions over the last year and a half, and I mean, every time I meet him, it's just fantastic, and I come away from there like 2 feet taller. I think it's fantastic. So, I mean, the enthusiasm that we've heard from you today is not just in you, it is in your team. And that, I think, was repeated again when I was up in the 111 centre in North Wales only last week. So you went up there, isn't it?
Yeah.
And again, you know, that enthusiasm there, and that was replicated in your team meeting, the way you managed that team. I mean, it's inspiring, actually. So that's really good. The other thing I wanted to mention was, I think, you know, Lee said about luxury. Yes, there is a bit of luxury in that you've got great facilities and you've got the luxury, you've got people in one hand. So that, you know, on the one hand, but always wanted to have balance. You've got call center issues because what you're running is a call center, and you are employing, you know, younger people who are at the lower end of the wage bracket, who are starting their careers, and all of that brings huge challenges. So although there are plus points, you're also having to work in an environment where there's lots of competition outside for jobs. Lots of the call centres are trying to recruit and pinch staff, and plenty of people can move from the stress of a call centre to go and work in Tesco's for more money and less stress. So yes, there are some luxuries, but you know, you're doing this in an environment where actually there are an awful lot of pressures, which kind of negates some of those luxuries. So I just wanted to put that balance in. And I was just thinking, for 101 conversations, I think, Lee, probably you're saying you're not going to have 999 conversations. Just looking around, anybody want any last 1 minute word? No? It really was inspiring. Thank you very much for your time, Peter. You can tell we've enjoyed it. You can tell we've learned a lot as well. So thank you very much, and time very well spent.
Thank you. Thank you very much.
Thank you.
Good. Okay. We'll move on if we may. Then we've got a couple of items, and then we'll take a short break in about half an hour's time. So item number 9, progress on actions to mitigate avoidable harm. This, of course, is the paper that we've been having repeatedly. It's in connection with our 2 highest risks about being able to not deliver the service that we want to, because ambulances are being held up in hospitals, essentially. Jason, do you want to talk to this?
Thanks, Chairman. Yeah, and I'll probably bring Rachel in and possibly Lee on a couple of points. So I'll take the paper as read. Just a few things I just want to say around it. So obviously we've been in and we're going through the most challenging part of the year for us. That said, that there is some good news, which is just worth reflecting on. So red performance in December, so the month just closed, landed 10 percentage points ahead of the December previous. So 10 percentage points ahead of December 22. In that month, there were 58% less 12-hour or more waits or responses than there were in the December the previous year. So whilst patient experience continues to be challenged, as of course it does for our people across the organisation, there are improvements coming through in what we're seeing across the system. The paper updates the board on some of the actions which have been underway, and of course our winter plan, which we saw in the first iteration of this paper back in November, focused on 5 areas which we were largely in control of, and the things that we were going to focus on. So that was capacity or production, putting out as much capacity as we could, and of course if we look at the individual days, hours, days and weeks of production over the last few months, we see solid production in EMS and more ambulances on the streets this time at this point in the year than we had in the previous year, despite some of the pressures we've had on overtime availability and so on. So we've got stronger hours, more hours on the streets. We've focused on demand management, so the consultant close rate and work there to continually push that up. And whilst we've had challenges with the percentage of activity being managed through consultant close, the overall volume of patients being closed safely and successfully through consultant close continues to rise compared to the same period last year. We focused on efficient use of resources. So we've heard a lot just now in Pete's presentation about the use of resource in 111 and better availability of our people in 111. And an example I'd use in EMS would be the work on multiple attendance ratio, so reducing the number of vehicles we send to each incident, therefore freeing up capacity to go to other places. Work on pathways, I'll come back to that in a second, around conversations we're having directly with individual health boards about that, and then work on staff wellbeing. Angie, we've touched on some of that already, and there's a lot of detail in the People and Culture Committee. So 5 areas that we focused on this year to make us more resilient as we headed into and work through winter. And the final point I'll just talk to before I hand over to Lee and Rachel, who may want to say more, is on the last penultimate paragraph, sorry, in the paper, paragraph 18, which touches on individual conversations we're having with health boards. So there's 2 types of conversations going on here, really. The first is perhaps a more tactical one about things that we can do now on an individual basis with health boards to ease pressure and improve flow or support the experience of our staff at work. And so there's a couple of examples here just worth citing. Really good feedback coming from our people about work that's underway at Morriston for facilitating a smoother and more rapid end of shift handover experience. And of course that it improves availability because our people are coming back in on time the following shift rather than having to come in late if they finish late. So it's a good joint work with Morriston or with Swansea Bay Health Board, particularly at Morriston there. We've got similar examples in BCU at YGC with end of shift facilities being introduced there. We had a productive meeting with the team at Nara and Bevan just before Christmas as well, not only about cohorting and an end of shift facility at the Grange, but also about some other areas which could help us and therefore help health board colleagues with flow, such as pathways for fractured neck and femurs and others. So a productive conversation there with the team at Nara and Bevan in December. And then separate to that, Rachel and I are on a round of meetings, engagement meetings with chief executives of health boards and their teams, which are forward focused, Chair. So these are kind of up and out of the operational detail, but looking ahead and as a national provider, that is more than just ambulances now. We're engaging in local conversations with each of the health board leadership teams about what it is we can do in a smarter and better way to support and help them with the local challenges that they have in their health economy. So those conversations are going on separately, not necessarily giving us any advantage now, but should bear fruit, positive fruit in the medium to longer term. So I don't know if Rachel and Lee want to add anything. I'm happy to take questions on the paper.
Rachel, you want
I wasn't going to add anything. No, we had the first of our meetings, haven't we? And they've been very positive, as you say. No, that I think you picked up on what I would have said.
Mm-hmm.
The only thing I'd add is that we continue now to engage in a series of weekly meetings with Welsh Government, the Commissioner and Health Board Chief Operating Officers. That's actually starting to bear some additional opportunities, which I need to probably bring through and reflect now into here. We just got to join that up. But there are some other initiatives starting to come off the ground, which is also, I think, positive. We've also started to see some responses, I think, there's a heightened response to some of the pressures that we're experiencing. So, we know as we've come through more recent weeks, some of the health boards have had some flow challenges, some greater flow challenges, as expected at this time of year. But actually, we've seen some leveraging of that in terms of perhaps taking some initiatives more broadly. So my example would be deploying a flow initiative at Royal Glam, CumTAF having an episode of high pressure, and then that being leveraged, I think, really, or seen as a platform in order to take the principle of that into the other 2 sites within the health board. So that's also been helpful, I think. And we'll be some weeks off now reviewing how they've gone, but locally there's really good connection to do that.
Thank you, Lee. Okay.
Thank you. Really helpful update. So I've got just a point I wanted to share from a meeting I was at earlier this week, and then a couple of questions. So we sat down with Mike Jenkins earlier this week with the Stroke Association, and we heard about the success of Visionable, which is sort of telemedicine, isn't it? Platform where our staff connect to the consultant in the hospital. And actually, we heard two really fantastic stories about patients who would come straight into the hospital in Cardiff and, you know, had treatment, gone home in a few days. And as Mike was saying, the potential outcome of that, if that hadn't been the case, it would have been either catastrophic or nursing care. So we look at this data all the time, but actually, you know, there are so many good developments behind the scenes. But we were talking about the challenges of implementing that across Wales and the dependency around, you know, consultants being available. So that was just a reflection, but for me, a really good example of the opportunity that we've got, which literally does save lives. So I had a specific question on the winter ambulance improvement plan. So on ESTEC, so we've talked about this a lot, and my understanding is that in some areas in Wales, they're working okay or well, but in some areas they're not. So is this increased emphasis through the improvement plan gonna help with that? Yeah, actually, that is my only question. Thank you.
Probably 6 goals.
Yeah. There may be two angles to it. So from a 6 goals perspective, so Nick Wood chairs the project programme board, which was yesterday. ESTEC continues to be one of the most important priorities for them. They've sent out planning guidance for next year for all health boards, and that continues to be one of about 4 or 5 things that they're going to request health boards to really concentrate on. From a performance perspective and from an activity perspective, we don't see any that are working particularly well for us in terms of volume of patients who are being able to go through that service for one reason or another. They may be working well for other parts of the hospital in terms of flowing patients from A&E, for example, but I don't know whether through your weekly meetings, whether that's been a focus from a health board perspective. That might be useful to hear.
Yeah. So I mean, look, I would concur with what Rachel has said. I'm not sure that any health board yet has got ESTEC nailed, certainly from a WAST perspective. In terms of the meetings, yes, we do have a range of conversations that are occurring. I think the one for me that shows the most optimism, I think, is with Health R, where they're actually even beginning to talk to us about direct referral from remote clinicians. Now, this is kind of much more of the attitude that we want to be hearing, which, you know, especially when we know a remote clinician, you know, may actually negate a whole load of NHS resource to get a patient to the right place. So that's a conversation that I hope will bear fruit. And the last thing I would say is, of course, we, as an executive, did raise, again, I think, the inconsistency of application of the national eligibility at our last joint exec meeting with NHS Wales. So it certainly remains very topical. But yeah, I would concur. I don't think any health board has quite yet landed it as intended.
Okay. Paul.
Kerry's picked up I was going to pick up ESTEC because, again, it seems the payback on the investment doesn't seem great. I was going to say on page 8, the graphs I think are really helpful for us, which shows the relationship between the number of red incidents attended and then the percentage, because I think we've always been hung up on the percentage. But looking at that graphic gives you a much broader view of what our response is. And the other thing, perhaps it's an individual thing, I didn't feel that it was as frantic, the system wasn't as frantic this year in terms of the demand and the ability of the system to respond. I don't know if that is right, but it didn't feel so frantic as last year. And I think that's borne out by some of the stuff that's come through in terms of the performance.
I mean, Lee may want to say more. I think it's fair to say we had a difficult first week of January. But I think the franticness, Paul, using your word, I think was for a shorter window this year than we experienced last. So it was a much more protracted period of difficulty and stress last year, whereas this year, largely, I mean, it still continues to be stressed, but largely it was particularly difficult, I think, in the first week of the new year, Would that be fair?
Yeah, I came into December convinced it couldn't be as bad as last year, and I was right. You know, when you look at how long we were at REAP 4, for example, much more contained in comparison to the previous year. What's occurring this year, it's like a bit of a reverse, because last January was a very calm January for us. This January is not. So we did have, we declared our BCI early January. Activity has been high against our projections coming through January. So I think we had a comparably different December, but we're now having a comparably different January.
It looks like last year's December is this year's January.
Maybe some slip through. I don't know, but yeah, January has felt harder.
Just felt different from that.
Yes.
An NED perspective, looking in at the data.
Yes.
Okay. Thanks.
Okay, so we've got Andy and then we've got Kevin. So.
It was just on the subject of ESTEC. Well, last it came up, it is the case that we still seem to struggle for a variety of reasons to get patients through the door of ESTEC. However, the eternal optimist in me still remains that we've 2 workshops with Welsh Government colleagues and a number of Health Board colleagues coming up in March, where I'm hoping that we can reopen the idea of what kind of patients we get through the doors. So as we go into then the next financial year, that provides us another opportunity to have another run at this, and hopefully go again. I'll keep colleagues updated in terms of whether that bears fruit in terms of those discussions. But there does seem to be a commitment, especially from Welsh Government, to be a little more liberal in terms of the people with our ability to access.
Good, thanks, Andy. Kevin.
Just on the 9.1 paper there, I just when I was looking at it, the RAG rating, every red is external to this organisation. So I just want, do we have confidence that those external partners are going to engage and work in a timely fashion with regard to the, and ESTEC is one of them, but all of the reds are external.
I mean, I think, Kevin, what I'd say perhaps in response to that is, of course, the 5 points that we highlighted for our winter plan were about the things that we can control and I guess make progress on ourselves, and that's potentially reflected here in the RAG rating. Of course, if we look at the reds, I've just flicked to the report. 24 through to 28 are where the most of the reds are. They're about system commitments. These are rolled up national views. Underneath that, there is progress in some health board areas, positive progress in some health board areas coming through. But yeah, these are rolled up national perspectives. But I could point to probably 2 or 3 of the 7 where we would be able to confidently say, there is progress coming through. But we've largely, exactly how Cardiff, CTM, we've obviously been focusing on the stuff that we can largely control ourselves.
Thank you, Chair. This is always a really difficult report, isn't it? It makes difficult reading, and I find this one of the most difficult things to consider, whether I'm sat at Trust Board or Inquest or Finance and Performance or any other meeting of WAST. And whilst it's good to see that December 23 was better in several ways to December 22, and I am like a stuck record here, Chair, so forgive me for this, but I am going to say it again. We cannot become complacent because the numbers and the stats are still staggering. Whether you consider 1,649 patients could have come to severe harm. We'd said we were going to eradicate 4 hours handover or more. There were over 2,000 in December. The ISC target for handover hours by the end of Q3 was 12,000. We were nearly 23. So there are so many things in this report that show us we've got a long way to go. People are coming to avoidable harm. And whilst it's good to see an improvement, we're nowhere near where we need to be yet. I do have a question. As Kevin has said, it's great to see on the appendix that those actions within our control we're making good progress on, which I welcome, because I think that's crucial that we do that. But in paragraph 5, we make reference to the Audit Wales investigation into urgent and emergency care. And I just wondered, I note we don't have the report yet. Do we have a timeline for that? Because I think that could make interesting reading for us.
So I caught up with Dave Thomas from Audit Wales earlier this week. There are drafts of some aspects of that imminently going to be all with stakeholders for factual accuracy checking and so on. So whilst I haven't got a date, it feels close.
Good.
Yeah.
Thank you.
I think Trish might want to come
I was
in.
just saying, we've also got Thea joining us just after the break, so she might be able to give us some more information on how close that is as well.
Great. Thank you.
And just as the audit committee, we asked for that those drafts come through the stakeholders as early as possible, because audit committee keeps asking where is this report and how does it fit with the work that we do. I think there's a multi-pronged attack about let's get this report out and learn from it.
Okay, I didn't see any other hands up. So just to sort of wrap up that this particular item, we're asked to note the report and consider if there are any further actions. There are a few further actions that we've been talking about. Of the 28, 29 actions, it's good to see that a lot of those are making progress. I just have a couple of questions just to ask about two of the amber ones. The Charu, they're still looking to complete that on with the rollout. We're having a word about that in a moment, and also the consultant close, because both of those two things help. They're both actions on there. So I don't know whether, Andy, you're the person just to give a quick update on how we're doing on the consultant close, moving from the 14-ish% to 17 we're hoping for, and the Charu
I'm probably going to defer some of that to
till
HR will talk to, but Lee, do you want to do the consultant?
That's fine.
Yeah, so we have seen, I mean, we hit 14.6 as we were coming through this month. It dipped actually just slightly last week. There is a degree, I think, of frustration is the wrong word, because as you've already pointed out, Jason, the numbers are going up, and so we shouldn't lose sight of that. We know why we had our challenge earlier in the middle of last year, very much production related. As there is a correlation. As the production improved, the return has improved. One of the gaps for the management team has been use of data. Now, Steve Clinton has been working very closely, and I'd asked for that to be brought forward with Johnny's team in order to improve the draw of data and the visualization of data. And much of this is telephony data. Now, there is a tug in here, and for colleagues to be, I want to be transparent with a tug that it exists, and there's a cultural tug. We have got a group of clinical staff who have come from quite an autonomous setting. They still have clinical autonomy, although of course that is now within the tools that they're using, but they have gone from a remote autonomous setting to a contact center setting, and the management of that is different. There is far more information and data. The information and data that we have would indicate on the face, and I'm saying on the face, that there is opportunity for more productivity. But we do need to explore a little bit more around how on duty time, and I'm really conscious of the words I'm using here, don't feel very humanistic. So please I don't want anybody to get confused. But it does look like there could be opportunity for more productivity. The challenge that presents for the management team is the conversations and the cultural difference for the clinical staff engaged, because that's not going to be easy. This is a journey I've tread before, and it is fraught, and we have to work with our clinicians on the data versus patient discussion. Steve is working hard to understand what is a reasonable output for a clinician that works in this setting, to then assess that against the variation that exists. And what I would say is there is variation amongst our clinicians. And so let me not make this about it's a target. Let me make this about a reduction of variation. And that's where, Steve is very much in the headspace of, and Angie and I have agreed to support some of the work, again, that Damon, our trade unions, have been talking to us about in terms of the cultural work on this, we're hopefully going to use some outside parties in order to aid us with that. So, we do recognise that there could be opportunity for more of what we've got. Culturally, I think we have to tread we have to tread this one together, because of course I want these very skilled clinicians to be engaged in how that can be achieved.
Good, thank you. I think it's a very interesting point. It might be something, Trish, that we might want to explore a bit more in board development, because there's a difference between what is the right target to go for, as opposed to chasing a target which was arbitrarily set. And we know that we've got a target that was set for us by Welsh Government of reaching 17%. That wasn't an unreasonable figure given the trajectory that we were delivering over past periods. I don't think there's any science to that 17%. It was where you've done a few percentage each year, so let's do a bit more. And it will be really interesting, I think, for us as an organisation to really understand, what is the appropriate level, rather than having something sort of given more arbitrarily, if you see what I mean. So
Yeah.
I'm hearing what you're saying, and I think it'd be really interesting to unpack it a bit.
Yes, I mean, although just to reverse that, Chair, I think I would want to say that actually the 17% is reflective of the organisation's ambition.
Yeah.
So this is really important. The organisation is continually looking to do more.
Yep.
There is a degree then in terms of how that then becomes something to which the organisation becomes accountable, but it just reflects the ambition, and we do believe that the opportunity is there. It's because that work was very carefully set out by Steve, so we do think it's there.
Yeah. Okay.
I think the other thing that's worth reflecting on, Chairman, in this mix, there's a lot of things are changing. Is that this year we're responding to more incidents or more work than we were last year because the pressure is lower. So last year we had a third, I think, of all activity that we didn't go to last year because of high levels of operation in the clinical safety plan, because of pressure across the whole system. This year that is much lower. We've got lower prevalence of high escalation, therefore we're going to more work. So we're servicing more activity than we were last year. And of course, the stuff that the activity that you take out through the clinical safety plan, bluntly, is a blunt tool. A lot of that is the stuff which may be suitable for consult close. So there's things moving around us that skew the ability to achieve the ambition. But underneath it, the headline I think that's just worth, that we touched on 2 times, hanging on to, is that we are successfully closing more in raw volume terms. More. But we're not sitting on our hands here. There is more to go at.
No, not suggesting for a moment that we are. No. And just on the chair, is there in terms of an update?
Sorry, Lynn, did you want to come in on that point? Yeah. Go on, if you want to go on that point. Yeah, just it was your question about kind of what's the right target, and I think there's some really good work going on in this space, but a couple of extra observations that may be helpful. One is the work we're doing around the increased alignment of our clinical workforce remotely. So how can we get the shared learning and understanding of variation that sits between 1s and 9s, because ultimately we'll be using the same clinical setup and we'll have much a better understanding of how it's applied in the different settings. And in many respects, it's just personal choice if you end up on a 111 or a 999 call. The people that come through and how we manage them, support them through the system is in our gift. There's a significant amount of work going on at the moment using the GIW framework for enhanced, advanced and consultant level practice, and thinking about what that means in the remote clinical consultation space and how that can be applied. And we've got Paula and Mike leading some really good work in that space. Opportunity that sits within digital. So as an organisation, we've been kind of pushing on the digital solutions that empower clinicians and give safety nets and empower patients and families. So we talked about Visionable as an example of digital. There are many that we are using. And I think the opportunities that they present for us to truly think about what consultant close actually means and what it means for us as a provider organisation for the wider NHS system. And I think for me, the bit that would be advantageous is when we get to next year's conversations in what this target might look like is, let's think about the population, let's think about the system, because we can achieve our target, but that may not be to the advantage of the patient, the family, or the system. And it might be that a lower percentage target is the right thing to do for the system, the patient, and the population. And I think we've got some more work to do as we walk through that space over the coming weeks and months.
Which I think plays my point about whether the 17 was an arbitrary number dreamt up by Welsh government or whether it's a thought out. Anyway, that's another point. And finally on charities.
Just to echo both my colleagues just on that one, the feedback Lee's just given there is exactly the feedback I get from Paul and my clinical team that's doing the clinical oversight within CSD. So yeah, that example of the potential for culture to strategy for breakfast, I think, is absolutely, borne out in that. So that is definitely a factor. And also echo the point about let's look at the patient and the outcome, not necessarily let's focus on a target or an arbitrary target. Anyway, to go to Charu, we're still on with the recruitment. There's still some of the staff being pulled through there. We've had some discussions around in some of the areas where we're still struggling to recruit to get those final numbers as to whether we start to build that into our annual recruitment plan, where we would recruit experienced paramedics as opposed to NQPs as part of the recruitment plan in some of those areas where we know we've got challenges in finding internal candidates. So that's still very much part of the discussion. So yes, on track to get to the 153, to that final number. Myself and Lee at SLT this week had a quite a good discussion around the deployment to Charu, where we still haven't, I don't necessarily think, nailed that, and where we trying to find that balance between ensuring there's sufficient capacity within the Charu resource to try and hit as many jobs as possible, without necessarily going to the point where we are over deploying and sending them to 50 jobs a day, but only actually arriving at 8 because they're being stood down. And given that this is a lot more complex than just deploying RRVs, which potentially it will be compared against, but there's a lot to work through there. Just through the course of this morning's discussions, actually, just been interacting with Greg, who leads on Charu within my team, about bringing members of Lee's team together, members of my team together to really start to push forward on a Charu working group. We have a task and finish group, which is more about the implementation. But now as we start to embed this, what's the future plans to keep pushing and get into that final solution instead? That's probably the wrong term, but get into that working methodology as to how we deploy Charu to the most effect. So lots ongoing in that kind of space.
Good, thanks very much. I'm just saying to, I think it was Kevin's point, that of those 29 actions, the red ones are by and large out of our direct control. A couple of the amber ones, like the Charus and like the here and close, actually are in our control. So it's useful to get a little bit more detail on those. So thanks very much for that. We'll keep this running, I presume, Jason, and we'll continue next time to have a separate paper on this avoidable harm, as we've been doing for many months. So let's keep that rolling. What I have done in the past is I've asked the chairs of committees to comment on anything that they were talking about in relation to this topic, specifically in this item, rather than during their routine feedback at the end of the meeting. But I think today, for a variety of reasons, not least time, we'll not do that. We'll just ask committee chairs to comment on mitigating harm issues as a part of their overall feedback a bit later on this morning. That's okay with everybody. So we've finished that item, I think, if everyone's content with that. We've considered and we've noted. So Trish, we move to you for the final item before we take a short break.
Thanks, Chair. So the board will see there's 14 principal risks on the register. All of them are assigned to a director and all of them have board committee oversight. There's a few of them that were reviewed by the Finance and Performance Committee last Monday. The others will be reviewed by People and Culture and the Quality Committee when it meets in February. So the scrutiny of those highest risks, those rated 20 and 25, are drawn out as they are in each of these reports with a bit more particularity in the executive summary. So 223 and 224, those risks related to our inability to reach patients in the community and delayed care causing harm, We've obviously discussed a lot of what we're doing around that in the item just beforehand. But you'll see in that executive summary the passage of this discussion. So yes, it's discussed here. Yes, it's discussed in executive leadership team. It will be discussed further again in quality committee with the oversight there. But I think importantly, it also drives the agenda of that committee. And so everything within that meeting is actually focused on that avoidable harm, as well as the compliance issues that committee needs to deal with. You can also see that both of those have been reviewed in month. You'll see some of the movement in the blue text, which I think pops quite nicely in this. So you can actually see there has been a really good review all the way through the BAF. Similarly with risks 160, which is our sickness absence risk, and 201, which is a reputation risk. You'll see again the passage of those in the oversight committees and a bit of the change in direction. So both risks have driven the agenda of the upcoming People and Culture Committee as well. And the reputation risk was discussed in some detail in the November meeting, as well as the November Executive Leadership Team Away Day. And that's actually led to a review of the title of the risk as well. So really more focused around stakeholder confidence in the delivery of the long-term strategy. And you'll see that coming through, and that will no doubt shape the changes in controls and actions, as well as the next few iterations come forward. So you'll also see there has been a bit of movement since the last meeting. So we've got risk 163, which is the maintaining strong trade union relationships. You'll see that that's increased slightly from a 16 to a 20. So you'll also see that the commentary box, which I think is quite helpful to give context for change, actually shows some of the movement, which is due to some of those challenging issues that have been recently escalated. But you'll also see there is a good amount of actions which are both in train and should be well underway and completed in the coming months. So hopefully we'll see some change to that risk as well. Risk 594 has also increased in score from 15 to 20, which is our civil contingency response risk. We foreshadowed that at the last board meeting, and really is driven by a lack of confidence of the release of vehicles from hospital following recent testing activity. And this was also discussed last Monday in the Finance and Performance Committee as well. Risk 139 is moved in a different way, in as much as this is the risk in relation to delivery of our statutory financial duties. It has actually reached its target score of 8, but we are going to keep it on the corporate risk register because it's a sort of risk that can fluctuate as we have a changing financial picture maybe coming into the next financial year. So normally it would drop off when it gets to target score, but we're just going to leave it on there for the time being. And again, that was discussed last Monday. And finally on that, there's a slight amendment to the IMTP delivery risk at 424, nothing too material though. And just lastly, Chair, I just wanted to mention we've got the next item is our structured assessment, which really draws out that the board does really focus and discuss frequently these risks, but there is more to do in honing our BAF to make sure that it is much more related to our strategic objectives. And we've got a piece of work that's well underway, and we're hoping to get some traction on that next week to bring something back about how we're going to actually transform into that strategic BAF into the next financial year.
Okay, thanks, Trish. Any questions? Trish, I don't see any hands going up. Oh, who's that? Oh, your hand?
Please.
Your hand.
It's just an observation, Chair, on 163, if I can. This is just perhaps to offer some comfort to the board. Whilst the trend is upwards, this is the 2-year relationship one, Jen, so I'm looking particularly at you. I think it's fair to say that the escalation or the rising trend here is not necessarily because there's been a decay or a deterioration in relationships, more that we've got a lot of stuff going on. And as a result of a lot of stuff going on, there are of course opportunities for tensions to emerge. But I think certainly at the senior and top level position, unless colleagues are going to say differently, relationships and dialogue continues to be strong and progressive, but it's just got a lot of stuff in the mix.
And if I can add on to that, it's something we picked up at the November PCC that it's not a deterioration in the relationship. It is about the amount of work and potential for tension to increase. But we also had a lot of feedback on the good partnership working that was happening, and we obviously have the WASP report as well. So yeah, the score has gone up slightly, but it's not as concerning as it might seem when you look at the score.
And I hope, because Julie and I sat down and I tried to make that really clear about the amount of change taking place. So I've tried to pull that out, because I think just looking at it in the cold light, you can think, oh my goodness, what's happening? But, you know, I do think there are lots of things all at once that we're dealing with. So I do agree, Jason. And I know the work we're doing next week about the continuing work about building relationships and trust is showing that evolving. But there is lots that we're trying to manage.
Okay, good. Well, thanks very much, Trish. That's fine. We're asked to note the report. We're asked to acknowledge the assurance that the risks are being dealt with at the appropriate place in the ELT and in the various committees. And then there were 5 different changes. I won't read it all out there in the papers, but different changes that you firstly highlighted. We note those. So on that basis, let's take a short break. We're slightly running late, but only by a few minutes. So shall we just take just over 10 minutes and meet back here at 20 past? 12-minute break. 20 past. Right, thanks for being so prompt, everybody. We're just waiting for the connection with Fleur. There we are. Good morning. Can you hear us okay?
Morning. Yes, I can hear you. Can you hear me?
Yes, loud and clear. Thank you very much. So I think we'll just hand straight over to you then, Fleur, to take us through the structured assessment.
Thank you very much, Chair. Good morning, everyone. So this is the annual structured assessment piece of work. I'll just go through some of the highlights, if that's okay. The report highlights a good improvement focus from the Trust in relation to governance. Committees and board meetings are well run, with arrangements focused on ensuring sufficient oversight for key areas of risk. Noticed you were just discussing risk just before I joined. There are some areas of governance that need strengthening, including addressing the number of policies whose planned review dates have passed and maximising the effectiveness of the BAF. However, we did find that the Trust has reasonable and well-considered plans for addressing these in a timely fashion as well. In relation to planning, there continues to be strong arrangements for developing and securing approval from Welsh Government to integrated medium-term plans for the Trust. We also found that the Trust could benefit from an even stronger focus on ensuring actions are specific, measurable, achievable, realistic and time-bound, and reporting on the delivery of the intended outcomes could also be helpful. And then finally, in relation to finance, we found a continued strong financial performance, both annually and over a 3-year period. There is strong financial planning, which recognises key unique and ongoing risks around some of the inefficiencies, which is caused by wider system pressures around handover delays, and also lack of available additional funding, which is common to all organisations. But we found that the Trust is very careful in the way that it mitigates those challenges. We raised some ways in which financial reporting and oversight could be strengthened in order to clarify the level of recurrent versus non-recurrent funding, which could be important given the ongoing financial challenges. I'd like to take this opportunity to say thank you to everyone who engaged with us during our review. We had some really useful conversations, particularly in agreeing the management response, and it's great to see that some of those actions have already been completed, including some during this meeting here today. That's all I was going to go through at a high level, but happy to take any questions.
Good, thanks very much. Fleur, yes, we've had the written chair's report that you suggested, and you said that was tabled today, so that will be a continuing piece of work now. Trish.
Thanks, Chair. Thanks, Fleur. Thanks for coming and presenting it, and thanks for all of your support through this as well. And just wanted to point out a couple of areas, particularly around the policy and the BAF. So, you know, we know that we've got a backlog, but we also know that we're seeing that freeing now. We're seeing a lot more policies coming through. We had a few at executive leadership team yesterday. Policy group is reporting directly into executive leadership team, so they're flowing through quite nicely and up into committees. We're also at the point where we're using chair's action for the approval of those policies, so that we don't have to wait months for that committee meeting. So I think there's some good flow and changes in that for this year and for next year. And also Audit Wales support for our approach to risk and the principal risks while we move into a transitional BAF. And I'm sure that we'll be able to build that next stage with you as well. And I think finally the area of real interest was the observation that members are providing that support and scrutiny, because that was an issue of discussion, and we made some changes last year. So it's great to see that that's coming through. So just wanted to express our thanks as well. Thanks, Fleur.
Chris, you want to come in?
Thank you, Chair. Thanks, and just to add my thanks as well for you to the report, which hopefully everyone will see is a positive report. It's certainly got some elements of it recognises elements of improvement from previous years as well. I just wanted to flag a couple of things on. You've seen the response to sort of some of the enhancements around some of the financial reporting, particularly the savings suggested. So the team and I will look to see what further we can enhance that. particularly from new financial year, I guess now, given where we are. But you know, there is an element of it's not quite. It's sometimes an element, you know, it's not quite the science that you might expect it to be. There's a little bit of art to it as well in terms of that distinction between recurrent and non-recurrent, and there's a grey area a bit in between things that are non-recurrent technically, but always happen, so they kind of recurrent. So we'll think about how we sort of present that in that context. The only other bit in there, I think, was the and we'll come on to the sort of the meeting cycles for next financial year later as well. But the highlight in there around the sort of bit of a beat we've got into now in terms of financial reporting, of having to or taking a presentation to Finance Performance Committee and a paper to the board, and that's probably going to continue. And I think that's probably a regular beat that's working quite well. But I take on board the suggestion with all the comment within it that you know, sometimes it's not possible because of the timing of the meeting. It is literally hot off the press. You know, we've submitted to government the day before, and then we presented to committee, and want to continue to do that so the committee gets the most up-to-date picture. But I take the point raised about perhaps not sharing that in advance with committee members for additional scrutiny. So where timing will allow going forward, we'll look to try and share that. It'll still be a presentation probably because it won't be done in time for the papers ahead of F&P, but where we can, and we've got a day or two window in between, we'll look to share the PowerPoint that we've drafted for that, even it's only the day before, just to allow that a little bit of extra scrutiny if needed into next financial year. Thank you, Chair.
Good, thanks, Chris. Paul.
Yeah, just in the absence of Martin Turner, the Chair of Audit, we had the draft report in November, and obviously now we've got the final report. At the next meeting of the Audit Committee, we'll be going into more detail to look at the structured assessment outcomes.
Good, thanks, Paul. Kerry?
Thanks, Chair. So really excellent report, thank you. I had a question on point 80. I think it's a really good challenge back to us around how we measure our progress in terms of the longer term strategy. And my question is, can you point us to any examples where trusts or health boards are doing this well?
Sure. Sorry, let me just make sure I'm looking at the right points. Yeah, so in terms of the long-term strategic framework, do you know, that's a really good question. Probably one I should go back and check with colleagues before I respond, really, to make sure that I can give you the best examples, if that's okay. So sorry, I can't answer it right now, but I'll check back and provide you with a response following the meeting, if that's okay.
Yes, absolutely, no problem at all. Thank you.
Great, thanks.
Good. Okay. Thanks very much. Looking around, I don't think there's any more. No. Okay. Flo, thank you very much for your time. Short and sweet. We were very pleased to receive it. We felt that on the whole, you know, we're doing okay. A few things to attend to, but as you said, we've got it all either done or well in train. So we look forward to next year's.
Thank you very much.
Oh, hang on a second.
Were you going to ask Fleur about the timeline on the report? Did you say that earlier, or did I imagine that?
The unscheduled
care.
Yeah.
Yeah, of course. I'm happy to respond to that. Yep. So in terms of unscheduled care, it's might be helpful just to clarify that it is an overarching piece of work with several key components within it. So the first part around how patients flow out of hospital, we've done the field work, and we're in the middle of all the draft reports which need to go to the health boards and the councils for factual accuracy checks, as Jason was mentioning earlier. But once those factual accuracy checks have been completed, we'll provide a national summary which highlights you know, what we found across Wales, as well as those regional reports. So of course, happy to share those once they're all cleared and completed, and then we'll be moving on to parts 2 and 3. Sorry, and we're going to be starting the field work on those imminently over the next couple of weeks. Part 2 is around how patients access and scheduled care, and part 3 is the national structures in place around EASC and the unscheduled care. The Urgent Emergency Care Board, the 6 Goals Board. So yeah, there's a couple of different pieces in there. The first part the report should be coming to the trust, you know, very, very soon, over the next month or two, I'd hope. And then there will be the further parts of that work coming over subsequent months once we finish the field work. We will provide updates regularly to the audit committee, but whenever you want a specific update to the board as well, happy to provide that.
Okay, thank you very much. Thank you very much. All right, so thank you for attending. Short and
Thank
sweet.
you. Bye.
Alrighty. Bye bye now. Bye. Good. Let's move on into Rachel.
Thank you. Yes, so I've got two slightly separate looks at the IMTP under this heading. So the first one is an analysis of or an assurance report on progress this year. This paper went to, or an extended version of this paper went to Finance Performance Committee with some more detail. So I wasn't going to pull out anything particular from it, but I was just going to note in the light of that discussion there that obviously from next year we've committed as part of the structured assessment, to making sure that the objectives we put in the IMTP are smart, but also that we develop a way to better link the actions that we're taking with the outcomes that we're expecting. So linking perhaps this and the performance reports a bit more closely. So but happy to take any questions in terms of any detail.
Okay. Is that on the first part? You say
on the first part,
so that you'll come on to
yes, I will do
next year's plan in a moment. Okay, so just focusing our thoughts on the current plan at the moment and where we are in terms of delivery as we quarter of the way through the year. Any questions to Rachel on that? We are where we are, aren't we?
I think it's worth saying, Chair, that the non-execs here were all at Finance and Performance Committee, so we saw the detail.
Okay, good. Good. All right, in that case, that's fine. So Rachel, move on to the second part, which is about looking at next year's plan.
Yes, lovely, thank you. So a couple of things just to, again, you've had a chance to read it, obviously, so just a couple of things to pull out. One, which is, I suppose, just to note the priorities that have emerged from Welsh Government through their planning guidance. That's always an important element of developing IMTP, and a couple of things are slightly different from last year. One is they're pulling out value and sustainability as a kind of thread. They've got a value and sustainability board which Judith Paget chairs, and they'll be looking for us to be referencing, the kind of actions coming out of that. The ministerial priorities haven't changed, so that remains the same, and I think it's they are quite comprehensive in terms of the coverage across most parts of the NHS. So from that perspective, that's really helpful. We've also had draft commissioning intentions. Progress has been going well in terms of meetings, workshops. The next steps from our perspective is we've got a particular focus on finance and how that enables priorities on the 31st of January, and then we will be coming to board development with that kind of rounded set of kind of proposals, if you like, for priorities on the 22nd of February. So the other part of this paper, which I think Chris will just speak briefly to, is in relation to potential financial allocation next year.
That's okay, Chair. Yeah, just briefly, I won't go in perhaps presented some of this to Finance Performance Committee last week as well, so I won't go into perhaps quite so much detail as I did there, and it's in the paper anyway, but it was just to highlight that we're in our current sort of process now of in the throes, if you like, of looking to nail the financial quantums by which we will construct those plans around over the next few weeks and month or so. That would be heavily informed by what was issued just before Christmas to the health boards. I'm always pains to say, we're not directly allocated through that, but our commissioners are. So it gives us some intel, obviously, in terms of the level of funding and in particular uplifts that might be available. And ensuring that anything that's recognised within that we're treated as an equal partner of and receive a pass-through of uplifts as we expect it to be. And it's actually sort of stated within the covering letter that went out to health boards that should be the case. And health boards and WISC are expected to pass an appropriate level of funding for relevant non-paid inflationary increases in healthcare agreements for services provided by other boards and trusts, and importantly equivalent to the additional funding provided to commissioners. So that pass-through should come through. We need to continue to ensure that all the relevant elements of our quantum that needs to be applied to is recognised within that, and discussions on that are ongoing. There's a number of challenges, as you say, or risks you see within the paper that we still need to nail alongside that in terms of other funding levels. Things we've already currently committed to and making sure they're covered off. Whilst there's some additional funding to cover some of the cost pressures, particularly energy referenced within the allocation letter, some of those costs we're still forecasting out 15, 16 months from now, so it's still, they could be still quite volatile. So, and I think that the steer is very much for 24, 25. There will be no further in-year monies to support that. It's an upfront settlement. You live with it, so you have to manage. So, we've got to manage that in the same way as everyone else, and a few other elements as you see. Just in terms of the next, as you see within the paper, just to tie in with those next steps, as Rachel referenced there, there's a sort of half-day session in this room next week around the executive finance group to pull together what is probably still a 2 or 3 scenarios of what a plan could look like, depending on nailing some of those funding elements, which we'll hold down over the next few weeks beyond that. I have then a specific finance touch point meeting with Welsh Government finance colleagues on the 2nd of February. Everybody, all NHS organisations will be having similar meetings. There is an expectational requirement for us to submit an accountable officer letter by the middle of February 16th if we feel we're not going to be in a position to balance. I would like to think that we'll be, between now and then, following the conversations internally next week, and then with government and commissioners continuing beyond that, we might not be in that space for 24, 25. And then obviously the final plan and a detailed budget setting paper, hopefully separate to that, will come through F&P and board in March in the usual way. But clearly, there's an expectation from government that we will be presenting a balanced financial plan as part of that. And assuming the uplifts come through in the way in which we expect them to, there's probably no reason why we wouldn't.
Okay, any questions? Clearly, we're going to see more of this at the board development next month. Good. Doesn't look like any questions, Rachel. So that's fine. There's various things we're asked to do to note the progress and so on, which are all in the papers. So I think we've duly done that. Beth, you're standing in for Jogger. I know that Jogger may well have wanted to say something in his summary. Do you want to say anything now, or wait until you're giving an overall feedback?
I'm happy to wait, Chair. I think most of the points that I've written down that I would have covered have been covered by Chris and Rachel.
Okay, so
actually, they've picked them up.
Let's wrap it all up then towards the end.
Yes, thank you.
Okay, good. All right, in that case, we'll move on then to the next item, which is item 13, and that's financial performance, which is...
Thank you, Chair, again. So yeah, again, I'll take the paper as read. Obviously, this is the financial performance month 9, so focuses very much on the continuing delivery of our statutory financial targets for this financial year to month 9 and forecast. Again, it was supported, as I sort of alluded to earlier, in terms of the sort of bit of momentum that we've got in place now. This was, follows on and builds on a presentation that was provided to Finance and Performance Committee on the 15th of January. There's only a couple of things quickly I pull out of the paper. And I'll probably sort of highlight the, and I'm phrasing this deliberately, that these are outstanding assumptions that we've got. I'm not calling them risks because they shouldn't be risks, and they aren't risks, or if they are risks, they're very, very low risks. And in some cases, we've been told by government to not necessarily frame them as risks. But there is still some elements of outstanding money to flow through to us. One of them, the pay award, and even in meetings again this week, government have been very clear that that is their risk, not our risk. It's just timing in terms of that money flowing through to us. We have had to increase some estimates for some of our effectively a bit of a technical issue, but an impairment on a couple of our assets that have come online in year, and accelerated the depreciation of some of them compared to market value, compared to the cost we've incurred on them. That's a typical adjustment that you make when you bring something into use. But it's interesting, with costs increasing, the market value of things aren't necessarily increasing in line, so that impairment actually is getting a little bit higher. It'll be fun, it'll be funded by government in the usual way, but it's an issue that I think government are recognising is across the NHS currently. But that still needs to be nailed as part of our year end. Included in that is making sure we fully account correctly for any implications as a result of the ending of the agreement around the delivery of the previous 111 system. And we'll pick up a bit later an update, but again, there's funding assumptions associated with the continuation of a contract for our airwave system. But like I say, they're assumptions, and I'm not I'm assured and as comfortable as I can be at this stage of the financial year. Ideally, they'd all be in the bank by now, by the end of January, but they're not. But they will flow through, and they're not necessarily risks at this stage, as I say, just things that in the normal course of business we need to continue to work through. The only other thing I would highlight, and probably was less so at F&P because of the timing of the ledger closing and the update that we were able to provide there, is, as I think I've promised a couple of times over the last few months, there's a little bit more of a detailed update on the capital programme in this paper this year that we provided in a couple of more recent months. Again, just highlighting, you know, as we always have, there's some in-year variation in terms of spend both ways. There's some delay in the conversion of a couple of our vehicles that we expected to start in February. That's not now going to start until May. It's only a small delay in the context of, you know, the programme, but it straddles, falls at the wrong time of the year, so it straddles the year end and just makes it a little bit more difficult, a little bit more of a complex adjustment we need to make either internally or with government to make sure we balance and get the best value out of the money we got this year and minimise the impact into next year. But we're on that, and every confidence we'll manage that between ourselves and government if we need to. And I was going to mention, but we've already done it, obviously that we're in this dual period now of landing and closing this year and planning heavily for next year, but we've already touched on that bit, so I'll leave it there, Chair, if that's okay.
All right, thank you very much. Cool.
When you read the report, Chris, it looks easy. And I wouldn't, it does, it looks easy, and I wouldn't want us to underestimate the amount of work that's gone on behind the scenes, because we just see the report. I know finance performance go into much more detail, but I'm not on that committee. But it's quite easy to underestimate the amount of effort this has taken to come in to the level we are at the moment, and particularly around the savings. And so I just wanted a bit like Lee with a cautious view. Just let's recognise that there's a huge amount of work by everyone across the organisation to get us to this position. Because if you were outside just looking in, you think, oh, it's fine. Particularly when you look at the health force massive overspend. So congratulations to you and all the people who are involved in trying to keep us in financial balance, because I think it is important.
Yeah, thank you. That speaks for former chief executive.
Yes.
Who's been stained in the past.
Stained, yeah.
and recognises what goes on behind the scenes.
Thank you, Chair. I think it's important that I follow on from that, because I was going to make the comment anyway. You know, Chris, from the F&P meeting that we had last week, the committee members acknowledged that the continuing robust financial management across WASP, which is really not very easy to achieve, particularly given the substantial efficiencies that we've had to find as well. And the financial management continues to be really robust here, and that was recognised at F&P. And I smiled as you were saying that to Chris, and Chris made his usual comment, because he's always very quick to thank his team and say that they do so much work, as do all of the other directors and teams across the other directorates. It is a team approach, but it does need to be commended. So well done to everyone, not just Chris and his team.
No, and also, if I could just quickly, I think it's a really important point, and it's really important to hold that going into next year as well, because there is a potential, isn't there, to look at that and see, well, next year's uplifts may be in a different space than might we have expected them to be, and what does that mean, in terms of the ability for us to continue to balance and ensure that what is behind and underneath that uplift, those pressures and those costs and those demands and those service issues, etc., apply equally to us, if not more so in some cases than everybody else as well. Absolutely, exactly that. Not to be complacent, to maintain that, because we will need to balance next year and beyond.
We say every year it's going to be a tough year.
Yeah.
This year has been tough. And
I've said it before, haven't I?
Looking at the outcome, you think, well,
yeah,
could it be that?
This has been the hardest I've known in 30 too many years.
Thank you.
No, thanks very much. And just to echo clearly, continuing with our financial prudence and delivering the balanced budget next year is important as it is this year. It must be our goal. And we also possibly ought to recognise Angie's activities, because she got the chalice. I'm not sure if it was a poisoned one or not, but
no,
you
great teamwork.
You were the senior officer at Worth with a £6 million savings, which clearly form a part of the balance.
Well, on that point, can I just also give a big shout out to Ops, because they have taken the biggest brunt in terms of the work that's gone on there and making my job a lot easier, but also across the organisation in terms of the mindset shift we've seen about our staff saying, oh, we could do this, we could try and do this. So we've just got to maintain it.
Absolutely. Good. Okay. Any other points in relation to finance? We note where we are now, both capital and revenue, and the submissions to Welsh Government. So thanks very much, Chris. And we can move on to 14. Back to you then, Rachel, to the performance report. Yeah, performance report.
Thank you. So just to note this, obviously an iteration this was discussed at Finance Performance Committee. That was the November data, just the timing of the January F&P number. We had only November data. So this is now updated with the majority of the December data, so that's helpful to see. I was just going to put out, as I've set in paragraph 4 of the SBAR, that there are still some metrics which we agreed as a board which would be part of this pack, which haven't yet been agreed in terms of a data definition or what that will exactly be. So we are conscious that there's work to do in the remaining quarter of this year, particularly around reporting on the duty of candour, completed symptom checkers, and thinking through how we might demonstrate the value that we're providing through our 111 and CSD services. So we haven't quite landed what those metrics might be yet. So apologies for that, but they're slightly trickier to get hold of, I think. In terms of some of the actual metrics in the SBAR that's pulled out, I think we've probably covered quite a bit of them. I normally pull out, because we haven't discussed them as much, the 111 performance, but of course through Pete's presentation, we saw and heard a bit about the really good work that he and the team are doing in that space, particularly the festive period being a lot better than the festive period last year. And we just to note that we had Liam and Chris and I had a good meeting with the commissioners recently, who acknowledged the real maturity in that service, the sense of delivery, the sense of improvement, better relationships and working arrangements with our commissioners. And that was really positive to hear. I should have said that when Pete was here as well, to acknowledge that, but you guys know that that's what they were saying. Then, of course, we have pulled out through the harm report that Jason talked about some of those metrics around our EMS service, so we've picked up on those. As with the one I was just going to pull out, because we tend to put it just as a sentence, which is our PADR rate, and of course that links very much to it's so much more than a PADR rate. So yes, we're not achieving that in all areas, although 111 was a great example of where we are. So there's more to do in that, but that is very much a high level, under which sits a whole lot of other work that needs to go on to make staff feel connected into the organisation. As I say, we're going to try and work through that into next year. So happy to take any questions on any of the detail. Thanks.
Thanks, Colin. Can I just take us to 21, which is people capacity turnover, and the bottom left-hand graph, which is overruns. So we heard this morning, didn't we, a lot of positive work that's going on in 111 about the workplace experience for colleagues in 111. And whilst we've still got a long way to go on this particular measure for EMS colleagues, I think it's just worth drawing out. We're down from a peak of 55 minutes there or thereabouts as the average overrun, down in December, to something 10, 12 minutes, less. Now, of course, that's still way too long and occurring way too frequently, but is, I think, a measure of success on some of the actions that Lee and the ops team have been working on to improve the workplace experience for people in EMS. A long way to go, but I think it's just worth drawing out. This has been an intractable, difficult problem, and we've got some progress coming through, which is clearly positive for people.
So, in the narrative, I think it'd be quite helpful, where we talk about the 111 call abandonment.
Yeah.
It's clearly related, when you look at the graphs, to demand. I think it'd be worth drawing it up in the narrative, because if people don't look at those graphs, it looks as if the abandonment rate suddenly went up. But it does talk about demand, but it doesn't give a view of what that level of demand increase was. it might be useful to reflect them against each other, just to have a better understanding really of where that rate went up.
Yeah.
That's my only comment.
Yeah, thank you. Yeah.
Thank you, Chair. We talked earlier, didn't we, about the improvements we've seen in December, but complacent, and obviously the tail of Amber 1 year, the time was over 7 hours, which again signifies something. But I just wanted to acknowledge the significant improvement in complaint response times from the November to December, because as Rachel said, we had the November data in F&P last week, and there's a 20% improvement in months, so that's great. So I know the team has been working really hard, both sides, you know, within the ops and the and in Liam's team. So that's great to see. Long may that continue. My question is around immediate release directives. Again, I'm just so concerned to see such a high number of the Amber ones are just being refused, they're being declined. I know everybody has conversations with their peers across the board, I guess. Is there anything at all that we think we can do? Because we know there will be significant and avoidable harm happening because of failure for vehicles to be released.
I mean, I think it's a difficult one, Beth. I mean, we obviously, as I think I've shared before, report weekly and share compliance data with immediate release directives by as a group, but also by category underneath, you know, red and amber. We have got, you know, a much improved position on red, where pretty much now, you know, most weeks we go through with none being declined. Yeah, there are some weeks where we see a few, but if we think back a year or 18 months, that was a much, you know, worse position. Of course, the volume of ambers is one of the reasons why we see, I guess, so many rejected or declined. So we do provide that compliance data or performance reporting against it. But I think the area of focus certainly is with us and in working together with health boards is about what is it we can do to improve flow, but also how can we help better manage activity, and that by that what I mean is take away the activity that doesn't need to be there, so that activity that does go is then able to be managed in a more effective way. EASC does look at compliance performance for immediate release requests, but I think what colleagues are seeking to do is tackle the reasons for those delays in the first place, rather than hit head on the amber compliance in the immediate releases. I don't know if any of the team want to add anything to that, but I suppose we're encouraged where we're working with health boards locally. It's about how can we manage the activity in a different and better, smarter way, rather than fight the compliance measure.
And that, sorry, Chair, for making back. And that makes perfect sense in terms of using that strategy as a long-term or sustainable improvement. Of course, it does. It's just the impact in the short to medium term, isn't it? Whilst the longer term, because they're very complex issues, and we know that it's across the system. It goes into social care, it's the whole gambit. That's the challenge, isn't it?
I mean, just to echo Jason's point on that one, I think the difficulty with the amber is the sheer volume of amber calls. So if you were asking for an immediate release for amber, that's 70% of its activity, you know what I mean? So and that's the difficulty, is that we could essentially fill an E department with the amber activity, you know, within a matter of hours. So I think that really does kind of, for me, push the emphasis back on, well, it's the whole strategy of let's manage as many as we can in a different way to the front door of ED, and that way we won't need amber release, because there simply won't be as many patients there requiring amber release, and so it does have to go to that fundamental, you know, and you compare that, you know, where you've got 13-14% with red, you can see why it's easy to achieve red than it is to achieve amber, just on the sheer volume of presented patients.
A couple of hands up. We've got Damon, and then we'll come to Kerry. So Damon next.
Thanks, Jim. My question is a comment in relation to the executive summary item 4. And I just wanted to say, as a comment, for the comments earlier on, Lee, in respect of the 70% consultant clause and the difficulties around that, and I appreciate the way that was worded, because there are concerns from the workforce, and we're going through it. The question I had was in relation to the Charo and identifying sort of 30% utilization. Are we assured that we, the sort of the value for money in respect of, I'm guessing that's making a demonstrative sort of contribution towards the red performance. Is there any more sort of below that can explain how that's actually, relating to the red performance?
So I can't give you the figure, but we do know what contributes to red. And so we knew as we were growing, as we grew the Charo numbers, which of course we shouldn't forget is predominantly clinically the thing to do. So its main purpose has not been about performance. Its main purpose has been about clinical practice. But that there was the growth provided an additional benefit because we expected it to aid the red performance delivery. I see a daily performance report, and there are some days where I see more contribution from Charo than I do from emergency ambulances to red performance. So without having a chance to look, and I'm quite happy to have a look at what the contribution a longer period, I would say that I would be satisfied that we are achieving a red contribution from Charo. It's always, of course, a balance because we have many more emergency ambulances, and of course the demand and capacity modelling was always predicated on contribution from emergency ambulances, which was what supported the shift. More ambulances, less RRVs, eventually then to no RRVs to Charo for clinical reasons. Whilst Andy may comment on the clinical benefit, from what I see, I'm convinced that there is clinical benefit to the model. But one of the bits that we are exploring, and Andy alluded to it earlier on, is are we getting the best we can from our Charos? And what's, given it's a new resource type, what's the behaviour, what's the reality? And that's some work that we're starting to take a look at both clinically and operationally.
Can I just ask one other thing? So in moving forward, is there a figure of utilisation that you think would be the sort of scenario for that vehicle?
Let me start.
Go on.
So
Sorry.
So utilisation is an output.
Yeah.
So I don't target utilisation. So that's one thing I would always come up with in terms of target. I would never target utilisation. It depends, really, is the answer. Part of the work that we'll be taking a look at is, are we sending Charo to all the correct work? And if we send Charo to all the correct work, what would the utilisation output perhaps reasonably look like? So that's part of the conversations that we've now got underway. What we do know, whilst we're talking about utilisation, particularly as an output, is that for all of our other resources, it's too high. It's far too high to allow community cover, which allows us to be in the right place in order to hit an 8-minute response on red. So we do know that for our EA utilisation. Of course, what we have to be cognizant of, and the reason why we're looking at Charo utilisation as an output, is because from a very two-dimensional lens, you could say it's a poor use of resource because its output utilisation is very low. Now, of course, what we need to balance that against is what's the clinical benefit, what's the performance contribution, and what's the potential.
You want to comment?
I think Lee explains it far more eloquent than I can ever do, but I suppose this is the bit for me where it starts to illustrate the complexities of tasking Charo versus tasking RRV. So tasking RRV, we sent to pretty much everything because we weren't really focused on clinical outcomes. We just finished on getting that resource from A to B in a specific element in time. Now, the reality is now tasking Charo and the clinicians that's on Charo to a 06 code, that's a 06 echo, as a for instance, which is a difficulty breathing chest pains, will add very little clinical benefit over tasking an ambulance. And if we task an APP, probably even better, we'll probably leave it at home. But that becomes the complexity. Whereas now we're saying, well, if I task all my Charos to all the red codes, cool, we might hit the performance measures and do really well in utilisation, get the utilisation up, hit lots of red calls. But what our problem is then lots of cardiac arrest calls where Charu does add benefit, because now it's dealing with what is a massive amount of volume within red, which is 0.6 codes, but not any clinical benefit. And so this kind of starts to illustrate the complexity of where we're going from the two. And now we're never going to get that at first pass. And that's why, going back to my earlier conversation, we need a working group to keep looking at this and honing and changing and developing. So as you found that balance between utilisation, tasking appropriately, and clinical benefit, it's you know, we're opening Pandora's box really, and that's why we're getting there now.
It goes to the heart of the change that we're trying to create here, which is moving away from a blunt time measure, you know, which does not a lot, if anything, for patient experience and outcome, through to something which is much more targeted on the individual patient and the outcomes and the benefits we can offer through a more targeted and sophisticated approach. So it goes to the heart of this. You know, we can have a blunt model which stops the clock, but doesn't really do anything. It's well, that's an exaggeration. You know, is not sophisticated in how it manages the patient experience and outcome through to something which is much more targeted to benefit the patient experience and outcome. And that's the tension we've got as we transition through.
Kind of plays on point earlier about the 17%, doesn't it? You know, where did that number actually come from? Same argument for where did the 8 minute come from? Same thing, a bit arbitrary in some ways. Okay. Thanks, Tim. So we've got Liam waiting and also Kerry. I think Kerry was first. So go to Kerry and then across to Liam.
Thanks, Chair. So one observation and then a question. So I was going to come in on the amber one, and you know, from my perspective, until we're in a position where we know more of the outcome. So in December, I think I'm right in saying there were 389 amber ones refused on immediate release. So, you know, what was the outcome for those patients? So I think what you would tell me is we know some of it, but we don't know all of it. But for me, that feels really important in terms of, you know, driving a different response and for those conversations that, Jason, you have with your fellow CEOs. So that's an observation. And then my second point was just listening to the conversation here today around the journey that we're on, which obviously we're all behind that. And a conversation that I had with Kirsty Williams earlier in the week around our rural versus urban response model. So, you know, in these papers, it says about the challenges in terms of recruiting charities in rural areas. But as we're going on this journey, I think we've got to be mindful not to create more of an inequity in those areas. And I don't know if we have a position on that, if we have a view on that. But if we do, I'm looking for some assurance that we're looking at it through the wider lens of just Charus and particularly our red and amber response in all rural areas.
I mean, just to respond on that point, that has been a commissioning kind of intention for some while. Commissioners are really keen, quite rightly, to have a reduced variation. I think there's probably an acceptance when not everybody's going to be exactly the same on everything, but there is a very big variation in terms of response times in urban and rural areas, up and down actually. So I don't think we've cracked it. I think it's a good question. The slide that I was talking to SICKGOL's board about yesterday included that as something that we still need to think about in terms of our emergency response.
I guess the point is, in the short term, are we making it worse? Because our end goal is it's going to be better. And if we're doing that, we need to knowingly do that and mitigate.
I don't think I'm not sure I don't know what Andy was saying. I don't think we think that, but it's a good question, perhaps for us to go away and have a ponder.
Yeah, I mean, I was going to say, I was actually communicating with one of my heads of service as a conversation that prompted my mind earlier on, which is, you know, we know that we've got a Charu recruitment challenge in some of our rural areas. And so the team have thought, and I was trying to get an update in terms of where they're at, have contemplated what does a rotational model for this look like. So, because there are matters at play that concern staff. One of them are around the hours. So a Charu is not necessarily required 24 hours a day in some of our rural locations. And so, therefore, you start to get, you know, offering a paramedic to come off of a 24-hour rotation where there are unsocial elements to their pay, to a non-rota that doesn't attract that, is an impediment. But of course, at the core of this, we have matters of terms and conditions. And so one of the things that we have started to place onto the table is, well, what does a rotational model look like? Where you can retain an element of your unsocial because you'll do some of your hours on the ambulance, but if you can meet the standards, because we have to retain the clinical standards, if you can meet the standards, would you like to rotate onto a char route for some of those hours? So that's a concept that's in the thinking. I'm actually, as a consequence, I'm prodding to say, well, where are we at on this? I think we've got some discussions with trade unions to work through, and then we've got a matter of, well, if it's happening there, why can't we do it here? What I need to give my team the confidence and comfort to do is to pick a pilot location and to give it a go. If it's successful, then we can talk about what does it mean for station Y and station X and station Z, but let's just get a pilot underway. So I'd like to see, I think, a Welsh Pool's being suggested as a location that this could be suitable at. So I think what I'll do after our discussion today, particularly with this in mind, is to encourage the team to make progress so that we can get this pilot underway. Could offer some great variation for clinicians that are working rurally, as well as give them some of these additional skills, because they'll use the skills whether they're on a char route or on an ambulance. So all great benefits.
Good. Okay, thanks. Okay, Terry. Liam.
Yeah, I just wanted to come back on the amber as well. Just recognising public trust board, just to give public reassurance that when we know we're under pressure and we have an amber call that comes in that's prioritised, we do safety net that call, and the public call will always inform to let us know if they're deteriorating. So we would expect them to call back, and they will get an appropriate response if there is a deterioration. I think that the other element I just wanted to put a bit of reassurance around on the current delivery is actually we've got an enhanced role with our clinical support desk. So we talked earlier about how clinical support desk has a focus on consultant close. It is also part of the safety plan that sits within the organisation for dealing with excessive demand. And therefore, there will be clinicians reviewing the stack at any point in time, and they will be identifying those cases where they think there might be a risk of deterioration. They might be making direct contact with those patients on the basis to do an assessment for those reasons as well. So just a little bit of public assurance that they don't just sit on the queue. There is interventions that we try to ensure as well. More to the point, I think, is that Trust Board colleagues will know that we're looking, we put in place measures on the back of the new legislation, or the legislation that came into force last year. There's a refresh going on around how we are looking at our quality strategy. We've got a quality management group that's doing some really good work across the organisation. And I think that the 2 or 3 things that I think will come out over the next quarter that we will see kind of come through committees and into here are further work on the quality management strategy. So how are we doing that? What's our quality management system that we're going to adopt? How are we going to do that? Interestingly, we've had conversations with other UK ambulance services to that effect as well, because it's a challenge across the sector to get this right. So we are having those conversations, and I would expect us to be bringing some work forward there through Quest. And I think in the kind of more immediate term, we've got work going on led by Rachel's team, thinking about what we do with Welsh Government through ICAPs and how actually we might be able to do some of the stuff differently there, so that we have a greater alignment of the quality, the safety, the performance, and the quality improvement measures that we want to take, and the benefits that we're seeking to achieve, and actually bringing them together into one place. So it doesn't matter where we are in all of our respective organisations, we can see those benefits emerging in one place, and actually it will allow us to prioritise what resources we do have across the organisations to achieve those benefits in better form.
Good, thank you. Just looking around, I think that's no other comments in Rachel. So thanks very much. Okay, and we're asked to note the report. I think we've explored whether we need further assurances. There's a couple of areas of interest, so we'll see how those develop on Travis and so on. Okay, so item 15 to then, Trish, for governance report.
Thanks, Chair.
Seal, fixing seals.
Yeah, fairly short one. This is we've got the approval sought by the board of the affixing of the seal, not the approval of the leases, but the affixing of a seal as per our standing orders on a lease in Spring Meadow Business Park one which is a transfer of land and buildings to Swansea Bay University, and a WAST control centre lease for Carmarthen headquarters. So if you're comfortable with that, we'll affix the seal after this meeting.
Everybody content? No objections? That's fine. We approve that.
Sorry, can I just for board members to be aware, because you might not get it from 2.2. That's Kevin Coyd.
All right.
So
I guess
we're finally off the Kevin Coyd site and vacating it through this process. So because the technical address there is slightly different, but I just thought, just given the history we've had on that one, and it's been something that's been here for a long time. So that's Blackware and Kevin Coyd in the space of 2 months.
Very good. Okay, Trish, I think still with you for board dates.
Just on that paper as well, there's just a note there of decisions that we made in private session, bringing back into the public record as well from the November meeting. So the next item is the trust board and committee dates for 24-25, Chair. So you've got the calendar there. I think they've been well socialised with everybody. They're pretty much based on last year's dates. There may be some movement around the AGM and annual report, depending on what the final manual for accounts says, but we should know that in good time. So it's here for approval of those dates, and you may already have seen the population of some invitations in your inbox already this week.
Here we have a rush. Any comments, any thoughts? Are we content with those? Approving those. Right, thank you. So we're coming to the last few items on the agenda. Board committee reports, mainly verbal ones, because of the timing. Paul, do you want to give us an update? I think you're standing in for Martin in terms of the audit committee.
Yes, please. There were no audits from the audit committee in November. It was Martin's last meeting, so Chris, on behalf of the executives, thanked him for his service and his commitment, and I, on behalf of the men, did the same. So that was his last meeting. He had met earlier with Audit Wales and Internal Audit privately, as you should, for best practice. On the assurance, you will see that there were a number of things to pull out. I give a report back from PCC on the Speaking Up Safely programme and whether that was progressing well, and the audit committee got assurance that it was and demonstrated that. In terms of the policies, we had assurance of the plan, and we have oversight of the plan for the policy renewal, and we were happy with the progress that had been made. And similarly, in terms of the audit tracker, we were really pleased to see a lot of the outstanding recommendations had come off at the last meeting, which was good because some of them were actually superseded by other audits. One area where we were a bit disappointed, and that was the internal audits, particularly on the estate condition, recognising that actually it's the same for every NHS organisation. So when you look at it, and we had a limited assurance, the other audits were reasonable assurance. When you look at it, actually, it's the same for every organisation across Wales. So I wouldn't want board to think that we are different. And it just flies in the face, I think, of the work that we've seen over the last 3-4 years to improve our estate. And then you get that limited assurance. It just sort of bites a bit. So we sought some further clarity on that issue. The review of workforce planning arrangements, that was across Wales. They did WAST, and they were happy with the steps we are taking to have good workforce planning arrangements, recognising that sometimes the financial envelope is somewhat unsure for some part of the year. So they recognise that the plans we have in place is good. We looked at the structured assessments, which has come to the board today. We looked at the normal areas of special payments and single tender waivers, nothing of note in that area. And the committee priorities, we have had a transfer from the Finance Performance Committee to provide the oversight on the quality and performance management framework, and there was a verbal update at this meeting. November meeting on that, so we'll keep an eye on that. In terms of the risk management, we looked at the risks that are under the auspices of the other committees, just to check that they were being dealt with appropriately, and we got assurance that was done well. So I think that's all, Chair. that I wanted to bring forward, unless there's any comments,
No,
questions.
okay. Any comments? We'll content with that.
Oh, there's one thing,
Yep.
we did approve the audit handbook,
Mhm.
the revised audit handbook at that meeting as well. So
We good. Thank you very much. No questions? Contentment, good. So Bethan, you're going to be speaking on behalf of Jogger for the Finance Performance Committee.
Thank you, Chair. In the absence of a written report because of timing issues, I will quickly mention the reports we received, but a lot of those reports we've covered off today, so I won't add further comments. So we did receive the report on the IMTP, both in terms of progress on our current plan and planning for the next plan. I'm not going to say any more about that because we've covered those in some detail earlier on with Rachel and with Chris. Again, we had the financial position. We had a presentation on month 9, and again, that's been covered. We did have a report around the financial sustainability programme, which demonstrated the great performance that we've already recognised earlier. We're on target to achieve the £6 million of savings, which is no small achievement, really. And at the point of the discussion at the meeting, there was a position of an overachievement of almost 700k compared to the forecast at the end of month 8. The MIQPR we covered earlier, so I won't go into any detail on that here. We had a report around the digital KPIs, and this considered the review period from April to November last year. Some of the points that came up from that was around automation. We haven't made as much progress as we would have liked to have, but we are looking for ring-fenced funding for next year, 24-25, in order to make further progress on those areas. The staffing and resourcing is still a challenge. There's still a lot of pressure, and that was acknowledged at committee. And the refresh of the digital plan is well underway. We received a report around environment, decarbonisation and sustainability, and we were pleased to note that the action plan has moved from red amber to amber. We recognise there's good progress being made. The programme board risks have been reviewed, so that's an important aspect, and there's a corporate risk 542 being further developed around this area. Funding is obviously crucial in terms of some of the developments under decarb. There's an internal audit underway, and that is anticipated to come to audit and finance and performance in March. We had a report around fire safety compliance, and committee were pleased to note there's been really good progress made in this area. Of the works that have been identified as being necessary, only 6% of those fall into the substantial category, so that's positive. And of those 6%, 4% of those are due to be completed by the end of this financial year. So again, that's a really positive thing. All of the emergency lighting works have now been completed, so that's good to know. All of the FRA, so fire risk assessments, are being done by a new contractor. And again, it's anticipated that all sites will be completed by the end of this financial year. So again, great progress. Fire drills are being done at larger sites, and there's a plan being put in place to roll those out further to some smaller sites across West. From 24-25 onwards, we will be developing an annual fire safety compliance report, which is important, and that will continue to be reported to F&P in the future as and when it's completed. Paul has mentioned one of the 2 internal audit reports. He's mentioned both, the estates condition and the 111 commissioning. The one thing I wanted to add to the estates condition audit report was, we had some discussion around partly the rating is based on a lack of having a funded strategy to deal with the various issues. So I think that's important from a context perspective. We had the audit tracker clearly, and 17% of the management actions were closed in the quarter, which was again good to see. And also some historical actions were closed as well. We obviously considered risks. There are 8 risks that are specific in the main to F&P. We talked about risk 139, delivering our financial statutory responsibilities, and we managed to reduce that score to 8 from 16. So again, that demonstrates that the good work that's been ongoing. We also talked about Risk 594, which is about providing civil contingency responses, and that was referred to earlier. I think it might have been you, Kevin, that made a comment. So that risk has increased from 50 to 20. Finally, we talked about committee priorities, and they're all on track, as is the cycle of business and what we were hoping to achieve in this year. I'll stop at that point and then
Alrighty.
to take any questions.
Thank you very much. Very comprehensive. Any questions, Sebastian, on behalf of the Droga? Good. Okay, and then Kevin, academic partnership.
So we were informed that the trust application for university status has now gone to the minister, so we are awaiting white smoke with regard to that. It's been, I think it's worth acknowledging the effort of all involved in getting us to this point in time from scratch, and particularly Estelle's work in the background is very welcome. We were also informed of the appointment of the new non-executive director from an academic point of view, which fits nicely into that university status as well. Dr. Nigel Rees joined us, and we learned of his appointment as visiting professor at Warwick. And I think for context, it's important to understand Warwick University's, sometimes groundbreaking work in out of hospital settings over a significant period of time. We had a staff story around an academic sort of pathway. So Craig Brown came and sort of gave us some of his history, but spoke to us about he's now on a PhD pathway. So Mike Brady and Nigel were involved in that development with Bangor University. So Craig is on that pathway, and the important thing I think was how positive he was about the support and the framework around supporting somebody on what can be quite a daunting pathway for anybody. I mean, the three of us who were in the meeting who do have PhDs could certainly see that support being really positive, because we probably didn't experience it, because it's sometimes seen as a your challenge, not everybody else. And so it was really good to see Craig being enthused, but B, seeing that support network in place. And we did reflect on that, and we probably get Craig back once he's got past the initial stages, just to see how he's going and offer him more support, hopefully. So it was the last meeting for Paul and the last meeting for Martin Turner. So we thank them for their efforts and wish them both well. In private session, we did look at the feedback for Health and Care Research Wales annual review. Andy explained the challenges and the conversations that had taken place around the response, and looking forward to working more collaboratively, closely with them in the future. Held the effectiveness review, approved the annual report and changes to the terms of reference, both of which will come to the board in May for approval. Scope out the priorities, scoping out what university trust status will look like, what it means for us. And we've always been very clear in that committee that it's the whole workforce, not simply a clinical effort. And we'll hear in the trustee board meeting of the charity committee's meeting around a really good example of how that whole workforce agenda is playing out. No formal risks and no risks raised.
Good. Okay, thank you very much, Nick.
Just a comment. The Healthcare Research Wales and the R&D division in Welsh Government, we felt that it might be useful for the Academic Partnership Committee to meet with them, because there is clearly a bit of a disconnect between our expectations and their expectations and their level of support that they could give us. So as we are developing and maturing the academic partnership committee, it might be worth bringing them in so that we both understand each other's perspectives on research within WAST, because I think they still are a little hooked on the health board type work.
I was trying, sorry.
You were being subtle.
I was attempting to be.
I'm not very subtle, sorry.
So we've asked you for.
Okay, thank you very much. You've been awarded another PhD in subtlety. Excellent, good, thank you very much. Right, we come to a close really. We've got the consent items, 2 items there. We've not received any questions on those, so we can take those as duly noted, I think. And then on the closing items, the only other businesses, it's a shame that Martin's not here because you've heard about Martin's last outing in various committees. This would have been his last outing on a board meeting, so we can't in person thank him, but we'll do that via the minutes, and I'm meeting with him next week to go through the kind of formal exit process. So we'll record in the minutes our gratitude to Martin for the time that he has served us over the last four years on the board and in the various committees. Also, we've heard, as Kevin was saying, we've got 2 new non-exec directors joining us. First one, Peter, will be joining us to take Martin's place. He starts 1st of February, I think, isn't it? And I believe there's a public announcement going out today, or very soon anyway, to acknowledge his appointment. And we're very pleased to see him join us. He's got a long track record within Wales as a finance director in a variety of spheres, but not medical. So another non-exec joining us without specific health experience, but a lot of experience within Wales. So I'm sure he'll be a great asset. And then a bit later in spring, in March, I think, or April, we have Ian joining us from the academic recruitment activity. Okay, so that just leads me to resolve that we exclude members of the press and the public so that we can reconvene in private session after our lunch break. So let's draw this meeting to a close there. Are we doing 40 minutes or 45 minutes, Trish, for lunch?
I think we're booked in for 40 minutes, aren't we?
40 minutes, okay. So in that case, we're going to be meeting at 1:05 because we're running a bit ahead of time. So if everyone's okay with that, let's do that. Can I make a pre? We've been talking about lunches. I know we're not providing lunches any longer, but it's quite nice if we still use the opportunity to kind of socialise. And there's a temptation of everybody to scatter off to the four winds or stay here and so on. So we have got the kitchen upstairs. So I think the plan is if we could, if people have got lunch or if they're going to nip across to Waitrose